Chapter 2 Chemistry of Carbohydrate. Isomer definition. Isomers are substances having same molecular chemical formula but different structure. Isomers are substances having same molecular formula and identical structural form but different spatial configuration around one or more carbon. Isomerism is the process of formation of isomers. Type of isomer: structural isomer, stereoisomer, space isomer, geometric isomer, cis variety and trans variety, optical isomer. Structural isomer: these are the substances having same molecular chemical formula but different structure. This type of isomers differ with respect to physical and chemical properties. Butane and isobutane. Stereoisomer, space isomer. Substances having same molecular formula as well as identical structural form but different with respect to spatial configuration of atoms or groups around one or more carbon. This type of isomer sometimes shows identical physical and chemical properties. A spatial configuration means arrangement of atoms or groups around a carbon in relation to space. A spatial configuration means arrangement of atoms or groups around a carbon in relation to space. Three-dimensional space relationship of atoms or groups around a carbon. Types of stereoisomers. Geometric isomer. Geometric isomer is a variety of stereomers produced by substances having one or more double bond in their molecule. They could be in cis configuration where similar atoms or groups are oriented on either side of the double bond, or they could be in trans configuration where different types of atoms or carbons are oriented on either side of the double bond. Cis fumaric acid, trans fumaric acid. Optical isomer. Optical isomer is a variety of stereomer produced by substances having asymmetric carbon in their molecule, but they differ from carbon on their molecular and they differ from each other with respect to their optical activity. Asymmetric carbon is the carbon attached with four different groups or atoms. Symmetric carbon is the carbon attached with at least two or more same atom or groups. For example, CH4 or CH3OH. Optical activity. It is the property of a substance to rotate the same polarized light passing through its solution. If light is rotated to right side of the substance, it is called dextrorotatory. And if light is rotated to the left side, substances are called levorotatory. Substances attain this optical activity due to the presence of asymmetric carbon within their molecule. The glucose is plus 52.5 degrees. It means the delta glucose can rotate the plane polarized light to right side by 52.5 degrees. D fructose is minus 92.3 degrees. It means that D fructose can rotate the plane polarized light to the left side by 92.3 degrees. Epimers are the optical stereoisomers which differ with respect to the spatial configuration around only one asymmetric carbon but of more than one asymmetric carbon in the molecule. For example, glucose and mannose, they are C2 epimers. Glucose and galactose, they are C4 epimers. Definition of carbohydrate: polarized organic compounds having aldehyde or ketone functional group or aldehyde or ketone derivatives of polyhydric alcohol. Compounds which produce aldehyde or ketone derivatives on hydrolysis. In carbohydrate, number of carbon is always 3 or more, never less than 3. Monosaccharide or simple sugar. General formula CnH2ON, the simplest form of carbohydrate which cannot be hydrolyzed from further into simple form of carbohydrate. These are 3 to 9 carbon compounds and serve as a binding block for all carbohydrate. Among them, pentose C5C and hexose 6C are the most important. For example, glucose, fructose, galactose, mannose, ribose, ribulose, etc. Disaccharides, carbohydrate made of two monosaccharides, unites and joined by glycosidic bond. Sugars that produce two molecules of the same or different monosaccharide hydrolysis. For example, maltose, consisting of two glucose molecules, lactose, consisting of one glucose and one galactose. For example, milk. Sucrose, consisting of one glucose and one fructose. For example, table sugar. Oligosaccharide, carbohydrate made out of 3 to 10 monosaccharide units joined by glycosidic bond. Ig. Maltotriose, raffinose, blood group substance, etc. Polysaccharide, general formula C6H10O5 and it is also called glycans. Polysaccharide is polymer of monosaccharide composed of more than 10 monosaccharides unit connected by glycosidic bond. For example, starch, glycogen, cellulose, glycoprotein, mucopolysaccharide, etc. Sugar, carbohydrates which are water soluble, crystalline and sweet in taste. For example, all monosaccharides and disaccharides except for sucrose. Non-sugar, carbohydrate substances which are water insoluble and amorphous. For example, polysaccharides. Reducing sugar, sugars which act as reducing agent in alkaline media. Reducing sugar, presence of different aromatic carbon with free aldehyde and or ketone functional group is responsible for this reducing property of carbohydrate. Characteristic features of reducing sugar: reduce alkali CuSO4 solution. This is regarded as positive genetic test. Form osazone crystalline with phenylhydrazine. All monosaccharides, maltose and lactose are reducing sugars. Non-reducing sugar, for example, sucrose. Sugars have no free aldehyde or ketone functional group. Their functional groups are usually engaged in glycosidic bond formation. Sucrose is non-reducing sugar. Sucrose is composed of glucose and fructose. Glucose contains aldehyde group with first carbon and fructose contains ketone group with the second carbon. So glucose contains aldehyde group with first carbon. To form sucrose, glycosidic bond is formed between C1 of glucose and C2 of fructose. Glucose and C2 of fructose. Neither aldehyde nor ketone group is free to show their reducing properties, so the sucrose is non-reducing. Importance of lactose. As a component of milk, it acts as a dietary carbohydrate to provide energy. In congenital deficiency of lactose enzyme, lactose cannot be digested and cause lactose intolerance. Classification of monosaccharide. Monosaccharide is classified on the basis of the fundamental group they contain. Aldose, if contain aldehyde group as a functional group. Ketose, if contain ketone group as a functional group. It can also be classified on the basis of number non-carbon they contain. Triose, contain 3 carbon. Tetrose, contain 4 carbon. Pentose, contain 5 carbon. Hexose, contain 6 carbon. It is more acceptable to classify monosaccharides considering both functional group and number of carbon simultaneously as given below. Generic name: carbonong, aldose and ketose. Triose, glyceraldehyde, dihydroacetone. Tetrose, erythrolose. Pentose, ribose, xylose, arabinose. Ribulose, xylulose. Hexose, glucose, galactose, mannose, fructose. Glucose, galactose, fructose, ribose, ribulose, glyceraldehyde, dihydroxyacetone, primary alcohol group CH2OH of monosaccharide remains attached with the terminal carbon, which is the sixth carbon of hexose, fifth carbon of pentose, fourth carbon of tetrose, and third carbon of triose. In aldose, the aldehyde functional group is usually attached with the first carbon, and in ketose, the ketone functional group is usually found with the second carbon. Classification of polysaccharide. Homopolysaccharide. Polysaccharide of similar types of monosaccharide units connected by glycosaccharide bond starch. It is the polymer of glucose. Starch is found only in plant sources. There are of two types of starch: amylose, amylopectin. Glycogen, animal starch. It is the polymer of glycose and found in animal and human. It is the polymer of glucose and found in animal and human. Glucogen, dextrin, dextran, cellulose, and inulin. B. Heteropolysaccharide. Heteroglycan, polymer of different varieties of monosaccharide unit or their derivatives connected by glycosidic bond. For example, mucopolysaccharide (MPS) are also called glycosaminoglycans, carbohydrate part of glycoprotein. Amylose, polymer of 120 to 1000 alpha D glucose units and represent 10 to 20% of starch. Sparingly water soluble and straight chain structure. Amylopectin, polymer of few thousand of alpha D glucose units and represents 80% of starch. Water soluble and branched chain structure. Glycogen, polymer of alpha D glucose units and obtained entirely from animal source. It resembles amylopectin. It has branched chain structure, but number of branches are even more than amylopectin. Common source of glycogen: liver glycogen, muscle glycogen. Dextrin, polymer of alpha D glucose produced by partial breakdown hydrolysis of starch. The enzyme alpha amylase causes random cleavage of glycosidic bonds well inside the starch molecule, producing different oligosaccharide fragments called dextrin. Polymer of alpha D glucose produced by partial breakdown of hydrolysis starch. Random cleavage of glycosidic bonds well inside the starch molecule, producing different oligosaccharide fragments called dextrin. Dextran, polymer of alpha D glucose units found by microbes, e.g. bacteria, yeast. Branch structure non-digestible and colloidal in nature. Clinically, dextran is used as plasma expander to prevent hypovolemic shock following blood loss during major surgery or fluid loss in other conditions. In hypovolemic shock, dextran is fused in blood. Infused dextran retains within blood vessels since it is colloid. This increases plasma colloidal osmotic pressure, so water moves into the blood vessel from extravascular space. Osmosis. This helps to expand and maintain plasma volume, blood volume. Cellulose, polymer of alpha D glucose and straight chain structure, derived from the plant source, for example vegetable, fruits, etc. This is non-digestible in human, so gives no energy in human. Insulin, polymer of fructose. It is water soluble, low molecular weight, MW 5000, substrate found in onion, garlic, etc. It has no dietary importance, but it is used for GFR measurement. Difference between amylose and amylopectin. Amylose represent 10 to 20% of starch. Low molecular weight, composed of 200 to 1000 glucose molecule. Sparingly water soluble. Unbranched structure, straight chain. Gives blue color with dilute iodine solution. Amylopectin represent 80 to 90% of starch. High molecular weight, composed of few thousand of glucose molecules. Water insoluble, highly branched, gives reddish violet color with dilute iodine solution. Difference between glycogen and starch. Features: glycogen starch source, animal source only. Structure highly branched. Molecular weight 10 to 40 lakh. Color with iodic solution gives deep red color. Important storage of carbohydrate in human. Structure: starch, plant source only, for example rice, potato, wheat. Less branched, only amylopectin or unbranched, for example amylose. About 5 lakh molecular weight. Gives reddish violet color. Maintain dietary carbohydrate in human. Difference between starch and cellulose. Starch, cellulose. Polymer of alpha D glucose. Polymer of beta D glucose. Straight or branch structure. Straight structure, no branched. Glucose unit linked by alpha 1,4 glycosidic bond. Glucose unit is linked by alpha 1,4 glycosidic bond. Digestible, non-digestible. It is food and act as a source of energy. It is roughage and gives no energy. Types of mucopolysaccharides MPS or glycoaminoglycans GAGs. Types possible site: hyaluronic acid, connective tissue, synovial fluid, etc. Chondroitin, SO4A, cartilage, bone, tendon, etc. Chondroitin SO4B, skin, blood vessel, etc. Dermatan SO4, chondroitin SO4 6, cartilage, bone, tendon, etc. Keratin SO4, keratin sulfur, cartilage, cornea, etc. Heparan SO4, heparan sulfate, cell surfate, basement membrane. Heparin, an anticoagulant, mast cells. Hyaluronidase, spreading factor, produced by same bacteria, depolarized and liquefy hyaluronic acid. It reduces the viscosity of tissue, which facilitates spread of infection. Isomers and sugars. Monosaccharides usually show two types of optical stereomerism. For example, DL isomerism and alpha beta isomerism. DL isomerism or D isomer L isomer. D and L isomer are optical stereoisomers produced by isomerization of a spatial configuration around the penultimate carbon, referring carbon adjacent to the primary alcoholic group containing carbon CH2OH. In case of glucose, the penultimate carbon is the fifth carbon because its sixth carbon contains primary alcohol group. The orientation of H and OH groups around the penultimate carbon determines whether the sugar belongs to the D isomer or L isomer. When the OH group of the carbon is on the right, the sugar is D isomer. When the OH group is carbon is left, the sugar is L isomer. In D and L varieties, the groups of the other carbon atoms, for example, second, third, and fourth alcohol atoms of glucose, are totally reversed. So they are mirror images of each other. D sugars are most common in nature. Our body can metabolize only D sugars, not L sugars. Phenolate carbon D glucose, also called dextrose. L glucose. Alpha B anomerism and alpha anomerism B anomer. Anomeric carbon, carbonyl carbon of sugar is the carbon which contains the functional group aldehyde or ketone group. In case of glucose or galactose, it is the first carbon, and in case of fructose, it is the second carbon. Anomeric carbon is symmetric in straight chain structure form. Monosaccharides possess tendency to make cyclic structure involving anomeric carbon. In case of glucose, aldehyde group of first carbon, anomeric carbon, can condensate with the OH group of fifth carbon to make the cyclic structure. In this process, the anomeric carbon C1, which was symmetric in a straight chain form, now become asymmetric, page 20, in the cyclic form. Due to this asymmetric nature, anomeric carbon attains the potential to produce isomers called anomers. Anomers are optical stereoisomers produced by isomerization around the anomeric carbon of monosaccharide in cyclic structure form. In this form, if OH group of anomer carbon lies on the right side, it is alpha anomer. If it is on the left side, it will be beta anomer. Optical activity of different sugars. Since monosaccharide chain contain asymmetric carbon, they are coupled to produce optical isomers and show optical activity by rotating the plane polarized light passing through their solution. If rotation or to right is rotated to right, it is called dextrorotatory isomer. If rotated right if to left, it is called levorotatory isomer. Sugar optical activity: D glucose plus 52.5, L glucose minus 52.5, alpha D glucose plus 112, beta D glucose plus 19, sucrose plus 66.5, D fructose minus 92 degrees. Invert sugar, sucrose. Sucrose is dextrorotatory with optical activity of plus 66.5. Sucrose is dextrorotatory. On hydrolysis, source produces D-glucose with optical activity of plus 52.5 with D-fructose with optical activity minus 92, resulting optical activity of the mixture of D-glucose and D-fructose finally become minus 20 degrees, which is levorotatory. Dextrorotatory optical character of source on hydrolysis is inverted to the levorotatory character. This change in rotation is known as inversion, and so the name is invert sugar. Important dietary carbohydrate type: dietary source: starch, rice, potato, wheat, etc. Lactose, milk and milk products. Sucrose, cane sugar, cellulose, vegetables and fruits, etc. Difference between lactose and sucrose. Lactose, sucrose, known as milk sugar, known as cane sugar, composed of D-glucose, composed of D-glucose and D-fructose. No invert sugar, reducing sugar, non-reducing sugar, form oxazone crystal with phenyl hydrazine. Do not form oxazone crystal with phenyl hydrazine. Can be straightened in lactating, can be synthesized in lactating breast, cannot be synthesized in human. Hydrolyzed by lactose. hydrolyzed by sucrose. The properties goes with the monosaccharide and disaccharide. Properties of carbohydrate. Properties of carbohydrate. These properties goes with monosaccharide and disaccharide. Physical properties. Water soluble, crystalline, sweet in taste and optically active. Chemical properties. Act as reducing agent in alkali media. For example, glucose reduced cupric ion of CuSO4 to cuprous ion in alkali media. It is known as positive Benedict test. Oxidized of sugar acid. For example, aldonic acid. If functional group containing monomeric carbon is oxidized. For example, glucose is oxidized to gluconic acid. Uronic acid. If primary alcohol group containing carbon is oxidized. For example, glucose is oxidized to glucuronic acid. Saccharic acid. If both anomeric and primary alcohol carbon are oxidized. For example, glucose is oxidized to glucosaccharide acid. Reduced to alcohol. For example, sorbitol, produced by reaction of glucose and fructose. Mannitol, produced by reduction of mannose and fructose. Dulcitol or galactol, produced by reduction of galactose. Ribitol, produced by reduction of ribose. Glycerol, produced by production of triose. Produce oxazone crystal with phenylhydrazine. For example, gluxazone, produced by glucose. Maltosazone, produced by maltose, etc. Produce glycoside by condensation with alcoholic group of another substance. Form ester with organic or inorganic acid. For example, glucose 6-phosphate. Important gluconic acid. Support hepatic detoxification. Gluconic acid importance function. Liver uses glucuronic acid for conjugation and detoxification of xenobiotics. Toxic substance. For example, drugs. Importance of mannitol. Treatment of cerebral edema and forced diuresis. Mannitol is an osmotically active solute which is important to cell membrane. So if mannitol is infused to blood, it remains in ECF and raises ECF osmotic pressure that draws water from ICF. So intravenous infusion of mannitol is clinically given to treat cerebral edema over by hydration of neurons. Mannitol is filtered at glomerular membrane but not reabsorbed from renal tube. Therefore, clinically mannitol can be infused transversely to cause forced diuresis. Mannitol is filtered at glomerular membrane but not reabsorbed from renal tube. Therefore, clinically mannitol can be used for transversely to cause forced diuresis. Importance of sorbitol. Sorbitol does not readily diffuse out of cell. As it accumulates in cell, it causes raised intracellular osmotic pressure and draws water in cells to raise intracellular hydrotic pressure. High hydrotic pressure causes damage to intracellular components, especially in neurons, nephron, retina and lens to develop neuropathy, nephropathy, retinopathy and cataract respectively. So far we have read definition of carbohydrate, classification of carbohydrate, sugar, non-sugar, reducing sugar, non-reducing sugar, classification of monosaccharide and classification of polysaccharide. The classification of monosaccharide and classification of polysaccharide, homopolysaccharide and heteropolysaccharide. Then amylose, amylopectin, glycogen, trypsin, dextrose. Then it comes to the differences between amylose, amylopectin, glucogen and starch and cellulose, and types of monopolysaccharide or glucoaminoglyan. Then isomers and sugars is talked about in this chapter, isomers and sugars. Then inverse sugar, sucrose, importance of dietary carbohydrate. Then the properties of carbohydrate. Later on we will have the Benedict test, the glycosidic bond, the glycosides, complex carbohydrate and muco substances. And then it will be biological important function of carbohydrate, glucose. Benedict test principle. Sugars are reducing agent in alkali media. Sugar reduce cupric ion to cuprous ion, which finally turns into cuprous hydroxide. During the process of heating, cuprous hydroxide is converted to red colored cuprous oxide. Benedict solution. Its native color is blue. It is composed of CuSO4, sodium citrate and sodium carbonate. CuSO4 furnishes occupied ion. Sodium carbonate serves as an alkali to ensure alkaline media. Sodium carbonate. Sodium citrate prevents precipitation of cupric ion. Clinical use. Detention of reducing sugar in biological sample, for example urine. Procedure. About 0.5 milliliter 8 drops. Sample containing reducing sugar is mixed with 5 ml Benedict's reagent and heated for 2 minutes and then allowed to cool. The formation of cuprous oxide participate and the consequent color changes to Benedict's solution from its native blue color to green, yellow, orange or red or brick red, indicate the presence of reducing sugars in sample. All these different sequential changing color from blue to brick red are not separated blocks of colors but merge into one another in a continuum. The color change from yellow to brick red depends on the amount of corpus oxidized participate. The more the amount of corpus oxide participate, the more the chance of color changes towards the brick red. The amount of corpus oxide participate is again directly proportional to the amount of directly proportional to the amount of reducing sugar present in simple urine. Interpretation. Benedict test is a semi-quantitative test where the color of the precipitate roughly parallel the concentration of reducing sugar in sample. Green 0.5%, yellow 1% gram, 1 gram percent, orange or 1.5, red 2, brick red more than 2. Reducing substance in urine. Presence of any one of the urine gives positive Benedict test. Glucose, homogeneous non-carbohydrate, sugar, carbohydrate. Glucose. Reducing presence of any one of these in urine will give positive Benedict test. Glucose, homogenistic acid. Fructose, salicylates. Lactose, ascorbic acid. Galactose and pentose. Glycosidic bond. Monosaccharides are connected with each other through glycosidic bond to form disaccharide, polysaccharide, and other complex carbohydrate. Carbohydrate can also be connected with other non-carbohydrate alcoholic substance called algecone through glycosidic bond to form glycosides. Glycoside bonds between sugar are named according to the number of connected carbons. Also, with regard to the position of anomeric hydroxyl group of the anomeric carbon participation in the bond. For example, C1 anomeric carbon of one glucose if bonded with C4 of another glucose, the bond will be as 1,4 glycosidic bond. If OH group of C1 anomeric carbon is alpha from the bond will be alpha 1,4 glycosidic bond. If the OH group of one anomeric carbon is beta from the bond will be a beta 1,4 glycosidic bond. In polymers of beta D-glucose, for example starch glycose units are connected by 1,4 glycosidic bond, wherein polymers of D-glucose glycose units are connected by B14 glycosidic bond. In human enzymes for carbohydrate digestion can break 1,4 and alpha 1,4 glucose bond does not be provided, so cellulose is non-digestible for us. Glycosides are substances produced by condensation of sialic monosaccharide with alcoholic group OH of the mother of another second compound. Formation of cyclic monosaccharides involves bonding between functional group containing anomeric carbon and alpha and fifth carbon. It makes cyclic hemiacetal if aldose of cyclic hematical is ketose. Second compound providing of group may be another monosaccharide or may non-carbohydrate substance. If the second non-carbohydrate substance also can provide OH group as second compound to make glycosaccharides. These non-carbohydrate substances are collectively called algecone. Commonly, algecones are methanol, sterol, glycerol, and phenol, etc. Cyclic forms of hemiacetal of monosaccharides are unstable. They provide the OH group and the anomeric carbon to make bonds with another alcohol group of a second compound to form stable alcoholic structure called acetal if aldose or ketal if ketose. These acetal and ketal substances are known as glycosides. Common glycosides are cardiac glycosides if contained in sterol and glycol, streptomycin, oubion, chlorhexidine, block glucose absorption in intestine. Complex carbohydrate amino sugar with amino NH2 group attached usually in the second carbon. For example, glucosamine and galactosamine and manosamine found in glycoprotein, mucopolysaccharide and glycolipid. An acetylated amino sugar with NH2 group at the second carbon and acetyl group attached to the NH2 group found in glycoprotein, glycolipid and mucopolysaccharide. Acetylated glucosamine, sialic acid in ensialate manosamine with pyruvate attached to the first carbon. It is found in glycoprotein and gangliosides, mucopolysaccharide and carbohydrate parts of the glycoprotein. Mucose substances characterized of mucose substance composed of carbohydrate and protein, which viscous and slippery, strongly negative and hydrophobic types of mucous substances. Glycoprotein, here protein is the dominant part, carbohydrate is the minor part. Proteoglycan, here portion of the presence minor part, here protein presents a minor part. Protein is dominant, glycoprotein and proteoglycan is a minor part. Functions: importance of mucopolysaccharide (MPS) and glycosaminoglycan, components of extracellular matrix, synovial fluid, vitreous humor, and mucus, etc. Acts as biological lubricant to provide protection against mechanical injuries and microbial invasions. For example, mucus of respiratory tract (GIT), urogenital tract contains mucus substances protect the body from microbial invasion. Mucus of alimentary tract allow easy slippage of food from mouth to down to intestine. Mucus substance in joint space and in different potential spaces prevent mechanical injury. Functions of glycoprotein: components of extracellular matrix, ground substance of connective tissue, acts as biological lubricant to provide protection against mechanical injury and microbial invasion. For example, mucosubstance in joint space and different potential spaces prevent mechanical injury. Cellular recognition of cell and interactions serve as a cell surface receptor. Cell surface antigens, for example, blood glucose and substance, enzyme, hormone, antibody, and structural protein, etc. Difference between mucopolysaccharide and carbohydrate of glycoprotein. Mucopolysaccharide MPS and carbohydrate part of glycoprotein. Glycosaminoglycan is GAG, but here it is glycoprotein. Long chain heteropolysaccharide, short chain heteropolysaccharide, mostly unbranched, highly branched, consisting of repeating disaccharide units. Don't have repeating disaccharide unit containing uronic acid, containing salic acid but not uronic acid, containing acid sugar, containing no acid sugar. Biological importance of carbohydrate and glucose. Chief source of energy. Glucose derives from the dietary carbohydrate is body. Glucogen production from the glucose acts as important storage for the energy in the body. Helps in protein and fat metabolism. Helps in nucleic acid synthesis by preventing ribose, pentose sugar, by providing ribose. Acts as protein and fat sparers. Prevents the glucose spare protein and fat from oxidation, catabolism. Precursor of synthesis of glycoproteins, proteoglycans and glycolipids. Glycoproteins, proteoglycans and glycolipids, consisting of structural components of biological membrane and receptors. Intercellular ground of substance matrix, biological lubricant, involved in detoxification of toxic substances in liver by providing gluconic acid. Important function of cellulose. Advantages: prevents constipation and maintenance of regular bowel habit, facilitates cholesterol excretion, keeps serum cholesterol low and reduces the risk of coronary artery disease, prevents the risk of obesity, diabetes and mellitus and colonial cancer. Disadvantages: it prevents the intestinal absorption of minerals Fe, Ze, Sa, Ca, etc. Lactulose and its importance. Lactulose is a disaccharide of galactose and fructose joined by beta-alpha beta 1,4 glycosidic bond. Lactose is non-digestible. Lactulose is important. Lactulose is disaccharide and fructose. Lactulose is non-digestible in human but digested by bacteria. Lactose is used to laxative in clinical medicine. Laxative. Source of physical importance. Glucose, main source of energy. Fructose, component of sugar, common sugar. Galactose, components of lactose, glycolipid and glycoprotein. Mannose, component of glycoprotein, mucoprotein. Inhibition of enzyme activity. Inactivation of enzyme and reduction of the velocity of enzyme catalyzed reaction is called enzyme inhibition, and the substance doing this is called enzyme inhibitor. Types of enzyme inhibition. Reversible inhibition. It is two types. Competitive inhibition. Here inhibition shows a structural similarity with substrate and competes with the substrate for same active site of enzyme. Inhibitors prevent substance to bind with the enzyme, so enzyme activity is prevented. Inhibition can be reversed by inhibitor, enzyme inhibitor, and chemical use. Monoamine oxidase, antidepressant. Allopurinol, xanthine oxidase, treatment of gut. Stains, for example, simvastatin, lovastatin. HMG-CoA reductase, cholesterol lowering. Captopril, enalapril, lisinopril, ACE, angiotensin converting enzyme. Antihypertensive. Penicillin, transpeptidase, antibiotic. Methotrexate, float reductase, anti-cancer. Non-competitive inhibitor. Here inhibitor is structurally related to the substrate. An inhibitor binds with the enzyme at allosteric site, not active site, and inactive enzyme, so they are also called allosteric inhibitor. Inhibition can be reversed by increasing substrate concentration, but can be reversed by dilution of enzyme inhibitor complex. For example, inhibition of trypsin by trypsin inhibitor, inhibition of acid phosphate by ethanol. Irreversible inhibition, non-competitive. Here inhibitors are structurally unrelated to the substrate, and inhibitor bind with the enzyme at allosteric site, not active site, and inactive enzyme. Inhibition cannot be reversed by increasing substrate concentration. They can be removed from enzyme only with the loss of enzyme activity. For example, heavy metal for calotase, disulfiram, alcohol and dehydrogenase, fluoride, enolase, insecticide, acetylene choline antares, cyanide, Na plus, Ka plus, ATPase, oxychrome oxidase. Difference between competitive and non-competitive inhibitor. Binds with active site of enzyme, binds with allosteric site of enzyme. Competitor binds with active site. An allosteric site binds with non-competitive inhibitor. Structurally substrate analog, structurally unrelated to substrate. Cause reversible inhibition, mostly cause irreversible inhibition. Reversible, irreversible. Inhibition relieved in increasing substrate concentration. Inhibition not relieved by increasing substrate concentration. Reduce the affinity of enzyme to substrate. Enzyme substrate affinity is not altered. Mostly concerned with drug action, mostly concerned with toxicological use. Application of enzyme inhibition. Reduced to affinity of enzyme substrate, mostly concerned with drug action, mostly concerned with toxicological use. Non-competitive inhibitor, competitive inhibitor. Application of enzyme inhibition. Treatment of disease. Study of metabolic pathways. Study of mechanism of enzyme action. Regulation of enzyme activity in biological system in vivo. In living system, temperature and pH are maintained relatively within a narrow range, and the product usually do not accumulate. So different mechanisms operate in living system in vivo to regulate the enzyme activity. Important mechanisms are compartmentation and substrate ability. It regulates the access of substrate to enzyme and thereby construction of substrate is regulated to regulate enzyme activity. Allosteric regulation act within the minutes instantaneous. Here, different allosteric modifiers regulate the rate of emitting enzyme of a metabolic pathway, either to stimulate or to inhibit their activity according to the cellular need. Allosteric modifiers bind with enzyme in the allosteric site. For example, citrate stimulates acetyl-CoA carboxylase to increase fatty end synthesis. Palmitoyl-CoA inhibits acetyl-CoA carboxylase to decrease the fatty acid synthesis. Covalent modification of enzymes act within minutes to hours, rapid. Hereby reversible phosphorylation, addition of phosphate and dephosphorylation, removal of phosphate, active of enzyme, especially the rate of limiting enzyme are regulated. Some enzymes are active in phosphorated forms and inactive in diphosphorated forms, whereas others are active in dephosphorated form and active in phosphorated form. For example, glycogen synthesis is active in dephosphorated form but inactive in phosphorated form. Glycogen phosphorate and hormone sensitive lipids are active in phosphorated form but inactive in diphosphorated form. Induction and repression of enzyme act within hours to days, delayed, where synthesis of enzyme is regulated to regular activity. When there is no need of enzyme activity, their synthesis is repressed, decreased. Conversely, when the body needs enzyme activity, their synthesis is induced. Following meal, insulin reduces the enzyme of glucose oxidation and replaces the enzyme of gluconeogenesis. Feedback inhibition. It is the negative regulation of the rate limiting enzyme of a metabolic pathway by the end product of the pathway. For example, cholesterol. The end product of cholesterol synthesis pathway inhibits the HMG or CoA reductase, the rate limiting enzyme of cholesterol synthesis. Activation of inactive enzyme, zymogen. Some enzymes, particularly proteolytic enzymes, are produced as inactive zymogen form. Zymogens are activated subsequently at the site of their action by limited proteolysis according to the cellular need and thereby cell regulatory enzyme activity. Principles of clinical enzymology. How enzymes can be used clinically for the welfare of patients. Enzyme catalyze the biochemical reaction, so the deficiency of enzyme leads to the metabolic disturbance leading to the clinical disorders. Enzyme distribution shows tissue specificity and transcellular locational specificity. Enzyme activity can be inhibited by different molecules in reversible or irreversible and in competitive or non-competitive manner. Enzymes can be produced commercially in laboratory by biomedical engineering for their chemical use. Plasma contains functional and non-functional enzymes. Functional plasma enzymes. These are found all times in plasma of normal individual. Their concentration in plasma is equivalent to or higher than their concentration in tissue, and they have definite physiological function in plasma. For example, thrombin helps in clot formation, plasmin helps in clot lysis, lipoprotein lipase helps in lipoprotein metabolism. Non-functional plasma enzyme. These are found in plasma at very low concentration and they have no physiologic function in plasma. In fact, these are intracellular enzymes where they perform definite function. But as a result of normal cellular turnover, a small amount of these enzymes may appear in plasma. However, in the case of cellular damage or necrosis resulting from injury or disease, large amount of these enzymes leak into the plasma to indicate the disease affecting the cells or tissue. For example, ALT, AST, ALP, C, PK, LDH, etc. Clinical importance of enzyme. Enzyme deficiency cause disease. For example, disease lactose intolerance, deficiency enzyme lactase. Lactose intolerance caused by lactase. Hemolytic anemia, glucose 6 phosphate, glucose storage disease, enzyme of glucose metabolism, lysosomal storage disease, lysosomal enzyme. Enzymes are used as diagnostic tool of disease. Diagnostic of disease, for example, liver disease, alanine aminotransfer, aspartate aminotransfer, raised plasma enzyme, obstructive liver disease, alkaline phosphatase, ischemic heart disease, creatine phosphokinase, muscle disorder, creatine phosphokinase, prostate cancer, acid phosphate, bone disorder, alkane phosphate, acute pancreatitis, lipase and amylase. Enzymes are used as prognostic tool of disease, monitoring of disease progress. Serial estimation of non-functional plasma enzyme in a disease may be used as an enzyme indicator to assess the progress of disease course. For example, following jaundice, serum ALT and ALP increase. Now, after initiation of treatment, serial measures of ALT and ATP at regular interval may be used to assess the progress of disease. Enzymes are used as therapeutic tool of disease. Treatment of disease, for example, disease, mitochondrial infection, deep vein thrombosis, streptokinase, urokinase. They cause clot lysis. Pancreatic insufficiency, trypsin lipase, acute lymphoblastic leukemia, asparaginase, emphysema, alpha-1 antitrypsin. Enzyme inhibition is used as therapeutic tool of disease. For example, peptide ulcer disease, gout, hypertension, hypercholesterolemia, inhibitor drug, omeprazole, allopurinol, captopril, simvastatin. Use of enzyme as laboratory tool for diagnosis of genetic disease. Enzymes are used as reagent to measure metabolites in blood and body fluid. Glucose oxidase, cholesterol oxidase and cholesterol esterase, triglyceride lipase, lactase dehydrogenase, urease, isoenzymes. Isoenzymes are enzymes which are functionally the same but structurally different. They are physically distinct from the same enzyme. Isozymes differ from one another with respect to structure and electrophoric property, immunological property, optimum pH, Vmax, K value, relative susceptibility to inhibitors, rate of reaction catalyzed. Importance of isoenzyme. A specific diagnosis of disease, different organ containing characteristic properties of different isoenzymes. Since isoenzyme shows a specific organ distribution to the by plasma isoenzyme patterns study is possible to detect, especially the tissue organ involved in the disease progress. Common isoenzymes are creatine phosphokinase (CPK), creatine kinase. Structurally, CPK is a dimer composed of two polypeptide subunits. Isoenzyme compositions and tissue distribution. Brain, heart, skeletal muscle, heart. In heart muscle, about 30% is CKMB, or rest 60% is CKMM. Clinical importance. High plasma CPK is suggestive of IHD, ischemic heart disease, MI, myocardial infarction, and skeletal muscle disorder. High plasma CPK especially suggests IHD or MI. Lactate dehydrogenase LDH. Structurally, LDH is a tetramer composed of 4 polypeptide subunits. Subunits are diagnosed as M, muscle type, and H, heart type. So there are 5 types of LDH isozymes: LDH, heart, RBC, LDH2, heart, RBC, LDH3, liver, lung, and kidney, LDH4, liver, lung, kidney, skeletal muscle, LDH5, skeletal muscle. Clinical importance of LDH. High plasma LDH is suggestive of ischemia, heart disease, skeletal muscle disorder, hepatic disease, and hypolytic disorder. Alkaline phosphate ALP. Structurally, ALP is monomeric protein composed of single polypeptide chain, but its isomers differs from respect to the carbohydrate residence attached to it. There are the 3 types of ALP isozymes. Hepatic PALP. It increases the biliary obstruction cholesterol. Pancreatic ALP. It increases within the increasing gestational age. Bone ALP. It increases in bone disease. Clinical importance of ALP. High plasma ALP is suggestive of liver disease and bone disease. HMG-CoA synthesis. This enzyme is used for synthesis of ketone body in mitochondria and cholesterol in cytoplasm. So there are 2 types of enzymes for HMG or CoA synthesis. Mitochondrial HMG-CoA synthesis for ketone body synthesis. Cytoplasmic HMG-CoA synthesis for cholesterol synthesis. Carbonyl phosphate synthesis is used for synthesis of urea in mitochondria and pyrimidine base in cytoplasm. So there are 2 types of isozones for carbonyl phosphate synthesis. Mitochondrial carboyl phosphate synthesis is used for urea synthesis. Cytoplasmic carbonyl phosphate synthesis 2 is pyrimidine synthesis. Nitrous oxide synthesis is catalyzed the synthesis of nitrous oxide NO from arginine. NO has 3 isosomes. NOS isosome in natural tissue, neural tissue, in neutrophil, and in endothelial cells. Cytochrome P 450 micromonooxidase. There are 100 different isozymes for this enzyme, and they catalyze the deoxygenation relation in the liver to deoxify exogenous and endogenous toxic substance. Hexokinase. These are enzymes of glucose metabolism. Cyclosinase work in platelets, stomach, and kidney. Cyclosinase 2 work in endothelial cells. There are enzymes of eicosanoid synthesis. Aminolevulinic acid synthesis found in all cells. Aminolevulinic acid synthesis 2 found in RBC precursor cells. These are enzymes of proporphyrin synthesis. Glutaminase, hepatic type and renal type. It converts glutamine to glutamate and ammonia. Thorax vertebra. When viewed from the side, the thoracic part of the vertebra column presents a curvature which is concave vertically and persists from a intrauterine life. Hence, it is called primary curvature. The thoracic cave is mainly produced by the reduced ventral depth of the vertebral bodies and extends from the 2nd to the 12th thoracic vertebrae. The extent of the 2nd vertebral bodies. The thoracic vertebrae are 12 in number. All are recognized by the presence of costal facets on the side of their bodies and costal facets on their transverse process, except in the last 2 thoracic vertebrae. The 2nd to 8th thoracic vertebrae and typical because they have common features. The 1st to 9th of the 12th vertebrae are 1st, 9th and to 12th are vertebrae and vertebrae are atypical, and each can be identified by specific distinguishing features. Features of typical thoracic vertebra. The body is heart-shaped. Since its transverse and anterior posterior diameter are almost equal, the upper thoracic vertebra and the bodies gradually change from the thoracic to cervical to thoracic type, and the lowest vertebra from the thoracic to lumbar type. The third thoracic process of the smallest body, and the fourth body is typically heart-shaped. The bodies of T5 and T8 are somewhat asymmetric because their left sides are flattened by the pressure of descending thoracic aorta. Two costal hemifasces are present on each side of the body of the typical vertebra. Close to the borders, the upper facet larger and lies in front of the pedicle. It articulates with the head of the numerically corresponding rib. The lower, smaller facet lies in front of the inferior vertebral notch and articulates with the head of the immediately succeeding rib. Vertebral foramen is small and circular. Because the spinal cord of this region does not present any significant enlargement, the pedicles are short and increasingly progressive in thickness. Traced when pressed cordially, the superior vertebral notch is ill-defined. Except for the first thoracic vertebra, it transmits preceding a spinal nerve. The inferior vertebra notch is cons- conscious in all thoracic vertebrae and transmits numerically corresponding spinal nerve. The laminae are short, thick, and broad, and overlaps from the above downwards. The upper borders and the lower border surfaces are adjacent. Laminae are connected by surface of fibroelastic membranes known as the ligamenta flava. The transverse process are large and cube-shaped and projects laterally and backward from the junctions of the pedicles and laminae. Close to their tips, the anterior surface bears oval costal facets to articulate with the tubercle of numerically corresponding ribs from synovial costal transverse joints. The costal facets of the upper six thoracic vertebrae are concave and directed anterior laterally. The facets in the succeeding four vertebrae up 10th are flattened and face upwards, forwards, and laterally. Medial to the costal facet, the anterior surface of each transverse process lies behind the neck of the corresponding rib and is connected to laterally by the costotransverse ligament. Costotransverse ligament. The blurred up lateral to the costal facets is attached to the non-articulating part of the tubercle of the corresponding rib by the lateral costotransverse ligament. The upper borders of the transverse process is connected to another rib and by succeeding rib of the superior costotransverse ligament. Posterior surface of the transverse process gives attachment to the deep ground of the extensor muscle of the trunk. The superior articular facets are flat and directed posterolaterally so that the facets of both sides lie in an arch of a circle. The inferior articular facets are reciprocally directed. Therefore, the zygopophyseal joints, facet joints between the adjacent thoracic vertebrae permit more free rotating movements than other joints. The spinal process is long and slopes down. Fifth to eighth thoracic spine are the longest and the most oblique, overlapping one another. The thoracic spine gives attachment to the interspinous and supraspinous ligaments and to the trapezius, rhomboids major and minor, latissimus dorsi, serratus posterior, superior and inferior muscle, and medial groups of erector spinae. A typical rib. First rib. It is the strongest, flattest, and most curved of all ribs and is the shortest true rib. The first rib slopes downward and forward, so the sternal end lies about 3 to 4 centimeters below the vertebral end. As a result, the apex of the lung and the covering pleural sac extend above the sternal end, but not above the neck of the first rib. The external end meets the widest part of the manubrium externally through cartilage at the first costochondral joint, which is primary cartilageous and replaced by bone usually after 25 years. Hence, the first rib does not usually move in quiet respiration. The head is small and bears a circular articular facet to articulate fully with the body of the first thoracic vertebra. The neck is rounded and extends posterolaterally with an upward inclination on the tubercle of the rib. The neck is rounded and extends posterolaterally with an upward inclination to the tubercle of the rib. The anterior surface of the neck is crossed. The anterior surface of the neck is crossed mediolaterally beneath the pleura by the neck is rounded and extends posterolaterally with an upward inclination to the tubercle of the rib. The anterior surface of the rib is crossed mediolaterally beneath the pleura by sympathetic trunk, first posterior intercostal vein, superior intercostal artery, and the ascending branch of ventral rumors of the first thoracic nerve. The tubercle is broad and prominent, projects backward. The tubercle is broad and prominent, projects backward, upward and medially. The articulates by its medial oval facet and articulates by its medial oval facet with the transverse process of the first thoracic vertebra. The angle of the first rib coincides with the tubercle and the rib is bent, so the head is directed slightly downwards, and the head is slightly directed and the rib is bent, so the head is directed slightly downwards. The side of the first rib can be easily determined by placing the bone on a flat surface when both the end and the external end should touch the surface. If wrongly placed, the head will be lifted above the level. The shaft is flat and presents an upper and lower surface, outer and inner borders. The upper surface is crossed by two shallow oblique grooves separated by a faint bridge which presents a small projection. The scalene tubercle close to the inner border. The scalene tubercle receives the attachment of scalenus anterior. The anterior groove lodges the subclavian vein. The posterior groove is occupied by the subclavian artery and usually the lower trunk of the bronchoplexus behind the artery. The area in the front of the subclavian vein is rough. The area in front of the subclavian is rough and gives attachment to the costoclavicular ligament and further in front of the subclavianus muscle. The area between the anterior groove and the tubercle receives the attachment subclavianus medius. The outer border is convex and thick in the posterior part. When the scalenus posterior swipes over the attachment of the second rib, the outer border is convex and thick, and the posterior part where the scalenus posterior sweeps over its attachment to the second rib. Behind the groove of the subclavian artery, the outer border affords attachment to the upper part of the first digitation of the serratus anterior. Behind the groove of the subclavian artery, the border's attachment to the upper part of the first digitation of the serratus anterior. The inner border is concave and thin and gives attachment to the suprapleural membrane. The lower surface is smooth and does not present a costal groove. Close to the long and outer border it provides along the outer border it provides attachment to the intercostalis externus and intercostalis muscle, intercostalis externus and muscle. Intercostalis intimus is absent in the first rib. Rest of the lower surface is covered by the costal pleura and endothoracic fascia. The first intercostal vessel and nerve passes along the surface between the intercostalis intimus and the costal pleura with the arrangement of nerve, artery, and vein from above to downwards, unlike the other intercostal spaces. The first intercostal vessel and nerve passes along the surface between the intercostalis internus and costal pleura with the arrangement of nerve, artery, and vein from above downwards, unlike the other intercostal spaces. Distinguishing features of the first rib: no twist, no angle as it is merged with the tubercle, no costal groove, most curved, shortest of all ribs, broad and flat from above downwards, single facet on the head small and circular, bears one nearly rounded facet for articulation and the upper part of the side of the body of the first thoracic vertebra. Attachments: capsular ligament of the first costovertebral joint to the margins of the facet. Radiate ligament in the anterior margin of the head. Neck: rounded facet faces upwards, backwards, and laterally. Its posterior margin gives attachment to the inferior costo-transverse ligament, while the superior margin gives attachment to the superior costo-transverse ligament. Tubercle: thick and prominent, faces upwards and backwards, coincides with the angle, has an oval facet for articulation with the transverse process of the first thoracic vertebra. Its lateral part gives attachment to the lateral costo-transverse ligament. Shaft: it possesses two surfaces, superior and inferior, two borders, outer and inner. Superior surface rough and irregular, superior surface crossed by two oblique shallow grooves separated from each other by ill-defined ridge. This ridge ends at the inner border of the first rib in a small projection called scalene tubercle. Groove in front of scalene tubercle lodges subclavian vein, while the groove behind it lodges subclavian artery and lower trunk of the branchial plexus. Attachments: scalenus anterior inserts into scalene tubercle. Subclavius arises from the rough area in front of the groove of the subclavian vein. Scalenus medius inserted behind the groove of the subclavian artery. Costoclavicular ligament into the rough area between subclavian vein and first costal cartilage. Inferior surface smooth surface, does not bear a costal groove. Related to pleura. Attachments: external intercostal muscle arises from the outer border. Internal intercostal muscle arises near the outer border, but not inner side of the but on inner side of the external intercostal muscle. Outer border convex, gives origin to the first digitation of serratus anterior behind the group of the subclavian artery. Inner border concave, bears the scalene tubercle near its center, gives attachment to suprapleural membrane, Simpson's fascia, and the scalene tubercle to scalenus anterior muscle. Anterior and large and thickest of all ribs. large and small ribs. Articulates with the first costal cartilage through which it is connected to the sternum. Important relations of first rib. Because of the obliquity of the first rib, the posterior end is higher than the anterior end, and clavicle is above the anterior end but below clavicle is above the anterior end but below the level of the posterior end. The pleura and the pecs of the lung arises above the anterior end and first rib for half inches. Anterior relation of the neck from medial to lateral side. Sympathetic trunk, superior intercostal artery, first posterior intercostal vein, first posterior intercostal vein, first thoracic nerve, lower branch of branchial plexus. Upper surface is related to subclavian vein and artery, and lower trunk of the upper surface is related to subclavian vein and artery, and lower trunk of the branchial plexus. On outer border is related to first intercostal artery and vein. It forms the inner inlet of thorax, so the structure of hole at the inlet of thorax comes in relation to it. Determination of site. It is done by the following points. Upper is rough surface bearing two groups should face upwards. Anterior end is expanded and should face forwards and downwards. Outer margin is convex. Atypical ribs. First rib. It is the strongest, flattest, most curved of all ribs, and it is the strongest of true ribs. The first rib slopes downward and forward, and so the sternal end lies about 3 to 4 centimeters below the vertebral end. As a result, the apex of the lung and the covering pleuris extends above the sternal end, but not above the neck of the first rib. The sternal end meets the widest part of the manubrium sterni through its cartilage at the first chondrosternal joint, which is a primary cartilageous and replaced by bone usually 25 after 25 years. Primary cartilageous. Hence, the first rib does not usually move in a quiet respiration. The head is small and bears a circular articular facet to articulate fully with the body of the first thoracic vertebra. The neck is rounded and extends posterolaterally with an upward and inclination to the tubercle of the rib. The neck is rounded and extends posterolaterally on the upward inclination of the tubercle of the rib. The anterior surface of the neck is crossed mediolaterally beneath the pleura by sympathetic trunk, first posterior intercostal vein, superior intercostal artery, first posterior intercostal vein, and ascending branch of ventral ramus of the first thoracic nerve. The tubercle is broad and prominent, projects backward, upward, and medially, and articulates by its medial oval facet over the transverse process, the first thoracic vertebra. The angle of the first rib coincides with the tubercle where the rib is bent so that the head is directed slightly downwards, and the slide of the first rib can be easily determined by placing bone on a flat surface. When both the head and sternal end should touch the surface, if wrongly placed, the head will be lifted above the level. The shaft is a flat and presents upper and lower surfaces, outer and inner borders. The upper surface is crossed by two shallow oblique grooves separated by faint ridges which present a small projection, the scalene tubercle, close to the inner border. The scalene tubercle receives the attachment of a scalenus anterior. The anterior groove lodges the subclavian vein. Posterior groove is occupied by the subclavian artery and usually the lower trunk of branchial plexus behind the artery. The area in front of the subclavian vein is rough and gives attachment to the costoclavicular ligament. The area behind the subclavian vein is rough and gives attachment to the costoclavicular ligament. clavicular ligament, and further in front of the subclavius muscle. The area between the arterial groove and the tubercle receives the attachment of scalenus medius. The outer border is convex and thick in the posterior part where the outer border is convex and the posterior part where the scalenus posterior sweeps over it for attachment to the second rib behind the groove of the subclavian artery. The outer border affords attachment to the upper part of the first digitation of serratus anterior, and the inner border is concave and thin and gives attachment to the suprapleural membrane, Simpson's fascia. The lower surface is smooth and does not present a costal groove. Close and along the outer border, it provides attachment to the intercostalis externus and internus muscles. Intercostalis externus and internus muscle. Intercostalis intimus is absent in the first rib. The rest of the lower surface is covered by the costal pleura and endothoracic fascia. Costal pleura and endothoracic fascia. The first intercostal vessel and nerve pass along the surface between the intercostalis intimus and costal pleura with the arrangement of nerve, artery and vein above downwards. Unlike the other intercostal spaces, second rib, it possesses a curvature similar to the first rib, but it thinner and twice the length of the first. The shaft presents external and internal surfaces. A short costal groove is found on the posterior part of the internal surface. The angle of the rib is situated close to the tubercle, where the bone is slightly bent like the first rib. The external surface is convex, facing upwards and laterally, and presents prominent tuberosity near the middle of the shaft. And the tuberosity gives attachment to the lower part of the first and the entire second digitation of serratus anterior. The narrow ridge extends backward from the muscular impression to the tubercle of the rib. The ridges give attachment to the scalenus posterior and further behind the scalenus serratus posterior superior. Above the costal groove, the rest of the internal surface is concave, smooth and directed backward medially. The other features of the second rib are similar to the typical rib. The 10th rib, it presents a single facet on the head articulated fully with the body of the 10th thoracic vertebra. Other features are similar to the typical rib. 11th rib, it possesses a single facet on his head articulated fully with the body of the 11th thoracic vertebra. There is no neck or tubercle, and the shaft presents a slight angle and shallow costal groove. The pointed anterior end is fitted with the cartilage. 12th rib, both 11 and 12th ribs are floating and slopes downward, forward and laterally. The pointed tips are fitted with cartilage, and the 12th rib is shorter than the 11th rib. It presents a single facet on its head for articulation with the body, and the 12th facet on this head for articulation with the body of the 12th thoracic vertebra. There is no neck, no tubercle, no angle, no costal groove. The 12th rib presents anterior and posterior surfaces, upper and lower borders. The anterior surface is concave, smooth, and faces slightly upwards, which helps in determination of the bone. The quadratus lumborum, with a covering of anterior layer of the thoracolumbar fascia attached to the lower part of the anterior surface, the medial half of the 2/3. Above the quadratus lumbum, the anterior surface is overlapped by the costodiaphragmatic recess of pleura. More laterally, the surface gives attachment to the diaphragm in the upper part of the diaphragm and to the transverse dominis in the lower part. Most laterally, the surface gives attachment to the diaphragm and the upper part of the transverse abdominis and the lower part. Transverse abdomini and the lower part, the posterior surface is convex and rough. Its medial half gives attachment to the mediolateral to the lowest levator costae. The medial half gives attachment to the mediolateral to the lower levator costae. Longissimus thoracis and iliocostalis, and the lateral half to serratus posterior inferior. Isthmus dorsi extend to the oblique muscles. The upper border affords attachment to the extended and intercostal muscle, and the lateral part encroaches on the interior surface. The lower border gives attachment to the middle layer of the thoracolumbar fascia and just outside the quadratus lumborum and to the lateral arcuate ligament and posterior layer of the thoracolumbar fascia. The lumbocostal ligament connects the transverse process lumbocostal lumbar 1 vertebrae to the lower 12th rib of the closer to the head. The special features: a costovertebral angle between the lower border of 12 and rib and the body of thoracic 12 vertebrae is encouraged by the costodiaphragmatic process of pleura. Between the a costovertebral angle between the border of 12 and rib is encouraged by the costodiaphragmatic recess of pleura. A renal angle formed between the lower border of the 12th rib and the renal angles between the thoracic and the lateral border of the erector spine. 12th rib, the lower border of the 12th rib and the lateral border of the erector spine is related to the posterior surface of the lower part of kidney. A renal angle formed between the lower border of the 12th rib and the lateral border of the erector spine. It's related to the posterior surface of the lower part of kidney. Posterior surface of the rear part of the kidney. The angle becomes tender in kidney illness, and the lower limit of pleural sac does not extend below the angle. Costal cartilage. These are flattened bars of hyaline cartilage extend from the anterior ends of the ribs. The impart elasticity and mobility of the thorax and prevent many crushing injuries from fracturing the ribs and the sternum. The costal cartilage are inophyseted and anterior parts of the embryonic cartilaginous ribs. The costal cartilages are anocyfilled anterior part of the embryonic cartilaginous rib. Because the primary ossification center of the ribs start from the posterior angle and have a long distance to extend before reaching the anterior part, which remain cartilaginous at birth. The upper 7th costal cartilages join with the sternum. The 8th to the 10th cartilages articulate with the lower border of the adjacent upper cartilage. The lower two cartilages possess free pointed tips in the muscular wall of the abdomen. The first chondrosternal joint is primary cartilaginous. Rest of the articulars are synovial. The first costochondral joint is primary cartilaginous. The first chondrosternal joint is primary cartilaginous, but the rest of the articulars are synovial. The interchondral joints are also synovial, except the between the 9th and the 10th cartilages, which are fibrous joint. The interchondral joints are also synovial, except that between the 9th and the 10th cartilages, which is fibrous joint. The costal cartilages increases in length from the 1st to the 7th, then gradually decrease to the 12th. The first costal cartilage inclines downward and medially. The first costal cartilage. The second is horizontal, and from the 3rd to the 10th cartilages incline progressively upwards. The cell and its functions. Each of the trillions of cells in a human being is a living structure that can survive for months or years provided its surrounding fluids containing appropriate nutrients. Cells are the building blocks of the body, providing a structure for the body's tissues and organs, ingesting nutrients and converting them to energy, and performing specialized functions. Cells also contain the body's heredity code, which controls the substances synthesized by the cells and permit them to take copies of themselves. Organization of cell. A schematic drawing of a typical cell as seen by the light microscope is shown in figure 2.1. Its two major parts are the nucleus and the cytoplasm. The nucleus is separated from the cytoplasm by a nuclear membrane, and the cytoplasm is separated from the surrounding fluid by a cell membrane, also called plasma membrane. The different substances that make up the cell are collectively called protoplasm. Protoplasm is composed mainly of five basic substances: water, electrolytes, proteins, lipids, and carbohydrates. Water. Most cells except for fat cells are composed mainly of water in a concentration of 70 to 85%. Many cellular chemicals are dissolved in water, others are suspended in the water as solid particles. Chemical reactions like place among the dissolved chemicals are at the surface of the suspended particle or membranes. Ions. Important ions in the cell include potassium, magnesium, phosphate, sulfur, bicarbonate, and small and quantities of sodium chloride and calcium. These ions are all discussed in chapter 4, which considers the interrelations between the intracellular and extracellular fluids. The ions provide inorganic chemical for cellular reactions and are necessary for the operation of small cellular control mechanisms. For example, ions acting at the cell membrane are required for the transmission of electrochemical impulses in the nerve and muscle fibers. Proteins. After water, the most abundant substance in most cells are proteins, which normally constitute about 10%. Except for fat cells, water is 70% and protein is about 10%. 20% of the cell mass, 10 to 20% cell mass. These proteins can be divided into two types: structural protein and functional proteins. The structural proteins are present in the cell mainly in the form of long filaments that are polymers of many identical protein molecules. A prominent use of such intracellular filaments is, is to form microtubes which provide the cytoskeletons of cellular organelles such as cilia, nerve, axon, and mitosis. Spindles of cell undergoing mitosis and a tangled mass of thin filamentous tubes that hold the part of the cytoplasm and nucleoplasm together in their respective compartments. Fibrillar proteins are found outside the cell, especially in the collagen and elastic fibers of connective tissue, and elsewhere, such as in blood vessels, tendons, and ligaments. The functional proteins are usually composed of combinations of a new molecular in tubular globular form. These proteins are mainly the enzymes of the cell, and in contrast to the fibril proteins, are often mobile in their cell fluid. Also, many of them are adhered to the membranous structure inside the cell and catalyze specific intracellular chemical reactions. For example, the chemical reactions that split glucose into its components part and then combine these with oxygen to form carbon dioxide and water while simultaneously providing energy for cellular functions are all catalyzed by a series of protein enzymes. The functional proteins are usually composed of combinations of a few molecular in tubule globular form. These proteins are mainly enzymes of the cell and, in contrast to the fibril proteins, are often mobile in their cell fluid. For cellular function at all catalyzed by a series of protein enzymes. Lipids are several types of substances that are grouped together because of their common property of being soluble in fat solvents, especially protein lipids. Are poly are phospholipids and cholesterol, which together constitute only 2% of the total cell mass. 2% of the total cell mass. So 70%, 10 to 20%, and 2%. Phospholipids or cholesterols are mainly insoluble in water. They are used to form the cell membrane and intracellular membrane barriers that separate the different cell compartments. In addition to phospholipids and cholesterol, some cells contain large quantities of triglycerides, also called natural fats. In fat cells, in adipocytes, triglycerides often control for as much as 95% of cell mass. The fat stored in these cells represent the body's main storehouse of energy-giving nutrients that can later be used to provide energy wherever it is needed in the body. Carbohydrates play a major role in cell nutrition and as a part of glycoprotein molecules have structural functions. Most human cells do not maintain large stores of carbohydrate. The amount usually averages only about 1% of the total mass but increases to as much as 3% in muscle cells. 3% to muscle cells. Occasionally to 6% in liver cells. However, carbohydrate in the form of dissolved glucose is always present in the surrounding extracellular fluid, so it is readily available to the cell. Also, a small amount of carbohydrate is stored in cells as glycogen in as insoluble polymer of glucose that can be depolarized and used rapidly to supply the cell's energy needs. Depolymerized cell structure. The cell contains highly organized physical structures called intracellular organelles, which are crucial for cell function. For example, without one of the organelles, the mitochondria, more than 95% of cells' energy released from nutrients would cease immediately. The most important organelles and other structures of the cells are shown in figure 2.2. Membranous structures of the cell. Most organelles of the cells are covered by membranes composed primarily of lipids and proteins. These membranes include cell membrane, nuclear membrane, membrane of endoplasmic reticulum, and membrane of the mitochondria, lysosome, and Golgi apparatus. So the membranous structures are nucleus membrane, endoplasmic reticulum, membrane of mitochondria, lysosome, and Golgi apparatus. The lipids in membranes provide a barrier that impedes movement of water and water-soluble substances from the cell compartment to another because it is not soluble in lipids. However, protein molecules often penetrate all the way through membrane, thus providing specialized pathways, often organized into actual pores for passage of specific substances through membranes. Also, many other membrane proteins are enzymes which catalyze a multitude of different chemical reactions discussed here and in subsequent chapters. Cell membrane. The cell membrane, also called the plasma membrane, envelops the cell and is a thin, permeable elastic structure only 7.5 to 10 nanometers thick. It is composed almost entirely of proteins and lipids. The approximate composition is 55% proteins, 25% phospholipid, 13% cholesterol, 4% lipid, and 3% carbohydrate. 45% cell membrane proteins. So the cell membrane has more protein, 7.5 to 10 nanometers. 55% proteins, 25% phospholipids, 13% cholesterol, 4% lipid, and 3% carbohydrates. The cell membrane lipids barrier impedes penetration by water-soluble substances. The structure of the cell membrane. Its basic structure is a lipid bilayer, which is a thin, durable layer form of lipids. Each layer only one molecule thick. That is continuous over the entire cell surface. Interspersed in its lipid form are large globular proteins. The basic lipid bilayer is composed of three main types of lipids: phospholipids, sphingolipids, and cholesterol. Phospholipids are the most abundant cell membrane lipids. One end of each phospholipid molecule is hydrophilic and soluble in water. The other end is hydrophobic and insoluble only in fats. The phosphate end of the phospholipid is hydrophilic and the fatty acid portion is hydrophobic. Because the hydrophobic portions of the phospholipid molecules are repelled by water but are mutually attached to one another, they have a natural tendency to attach to one another in the middle of the membrane, as shown in figure 2.3. The hydrophilic phosphate portions then constitute the two surfaces of the complete cell membrane. In contact with intracellular water on the inside of the membrane and extracellular water on the outside of the membrane, the lipid bilayer is the middle of the substance is impermeable to the usual water-soluble substances such as iron, glucose, urea. Conversely, fat-soluble substances such as oxygen, carbon dioxide, and alcohol can penetrate this portion of the membrane with ease. Conversely, fat-soluble substances such as oxygen, carbon dioxide, and alcohol can penetrate. Sphingolipids derived from the amino acid sphingosine also have hydrophobic and hydrophilic groups. Sphingosine are present in a small amount in the cell membrane, especially nerve cells. Complex sphingolipids in the cell membranes are thought to serve several actions, including protection from harmful environmental factors, single transmission, and adherence to site for extracellular proteins. So, complex sphingolipids, cells membrane barriers, are thought to serve several functions, including protection from harmful environmental factors, single transmission, sites for extracellular proteins, and adherent site for extracellular proteins. Cholesterol molecules in membranes are also lipids because their steroid nuclei are highly fat soluble. These molecules, in a sense, are dissolved in the bilayer of the membrane. They mainly help determine the degree of permeability or impermeability of the bilayer to water-soluble substances of our body. Cholesterol controls much of the fluid of the membrane as well. Integral and peripheral cell membrane proteins. Figure 2.3 also shows globular masses floating in the lipid bilayer. These membrane proteins are mainly glycoproteins. There are two types of cell membrane proteins: integral proteins, which protrude all the way through the membrane, and peripheral proteins, which are attached only to one surface of the membrane and do not penetrate all the way through. Other integral proteins all the way through. Many of the integral proteins provide structural channels or pores through which water molecules and water-soluble substances, especially ions, can diffuse between extracellular and intracellular fluids. These protein channels also have selective properties that allow the peripheral diffusion of some substances over others. Other integral proteins act as carrier proteins for transporting substances that otherwise. Other integral proteins act as carriers and that allow preferential diffusion of some substances over others. Other integral proteins act as carrier proteins for transporting substances that otherwise could not prevent could not penetrate the lipid bilayer. Sometimes these carrier proteins even transport substances in the direction opposite to their electrochemical gradients, which is called active transport. Still others act as enzymes. Integral membrane proteins can also serve as receptors for water-soluble channels, such as peptide hormones, that do not easily penetrate the cell membrane. Interactions of cell membrane receptors with specific ligands that bind to the receptors cause conformation changes in the receptor protein. This process in turn enzymatically activates the intracellular part of the protein or induces interactions between the receptor and proteins in the cytoplasm that act as second messenger, relaying the signal from the extracellular part to the receptor to the interior of the cell. In this way, integral proteins spanning the cell membrane provides a means of conveying information about the environment to the cell interior, or induces interactions between the receptor and proteins in the cytoplasm that act as a second messenger, relaying the signal from the extracellular part of the receptor to the intracellular interior of the cell. In this way, integral proteins spanning the cell membrane provides a means of conveying information about the environment to the cell interior. Peripheral protein molecules are often attached to integral proteins. These peripheral proteins function almost entirely as enzymes or as controls of transport of substance through cell pores. Peripheral protein molecules. Membrane carbohydrates, the cell glycocalyx. Membrane carbohydrates occur mostly invariably in combination with proteins or lipids in the form of glycoproteins or glycolipids. Membrane carbohydrates, the glycocalyx. Carbohydrates occur almost invariably in combination with proteins or lipids in the form of glycoproteins or glycolipids. In fact, most of the integral proteins are glycoproteins, and about 1/10 of the membrane lipids molecules are glycolipids. In fact, most of the integral proteins are glycoproteins. Integral proteins are glycoproteins, and about 1/10 of the membrane lipid molecules are 1/10 of the membrane lipid molecules are glycolipids. Most of them are integral proteins or glycoproteins. 1/10 membrane lipids are glycolipids. The glyco portion of those molecules almost invariably produced and protrude to the outside of the cell, dangling outward from the cell surface. Many other carbohydrate compounds called proteoglycans, which are mainly carbohydrate bound to small protein cores, are attached to the outer surface of the cell membrane as well. Many other carbohydrate compounds called proteoglycans, which are mainly carbohydrate bonds to small protein cores, are loosely attached to the outer surface of the cell as well. In fact, most of the integral proteins are glycoproteins, and about 1/10 of membrane molecules are glycolipids. Glycoportion of these molecules most invariably protrude outside of the cell, dangling outside from the cell surface. Many other carbohydrate compounds called proteoglycans, which are mainly carbohydrates bound to a small protein cores, are loosely attached to the outer surface of the cell as well. Thus, the entire outside surface of the cell often has a loose carbohydrate coat called the glycocalyx. The carbohydrate moieties attached to the outer surface of the cell have several important functions. Many of them have a negative electrical charge, which may give cells an overall negative surface charge that repels the negativity change object. Many of them have negative electric charge, which gives the cell an overall negative surface. The glycocalyx of some cells attach to other glycocalyx of the cell, thus attaching cells to another cell. The glycocalyx of some cells attach to glycocalyx of other cells, thus attaching cells to another. Many of the carbohydrates act as receptors for binding hormones, such as insulin. Many of the carbohydrates receptors for binding with other hormones, such as insulin. When bound, this combination active attaches internal proteins that in turn active a cascade of intracellular enzymes. Some carbohydrate moieties enter into immune reactions in discussed in chapter 35. Cytoplasm and its organelles. The cytoplasm is filled with minute and large dispersed particles and organelles. The jelly-like fluid portion of the cytoplasm in which the particles are dispersed is called cytosol and contain many dissolved proteins, electrolytes and glucose. Dispersed in the cytoplasm are neutral fat globes, glycogen granules, ribosomes, secretory vesicles, and 5 especially important organelles: the endoplasmic reticulum, the Golgi apparatus, the mitochondria, lysosome, and peroxisome. Endoplasmic reticulum, figure 2.2, shows the endoplasmic reticulum, a network of tubular structures called cisternae, that flat vesicular structures in the cytoplasm. These organelles helps process molecules made by the cell and transport them to their specific destinations inside and outside the cell. Figure 2.2 shows the endoplasmic reticulum, a network of tubular structures called cisternae, a flat vesicular structure called cytoplasm, and a flat vascular structure in the cytoplasm. This organelle helps process molecules made by the cell and transports them to their specific destinations inside and outside the cell. The tubular and vesicles interconnect. Tubules and the vesicles are interconnect. Also, their walls are constructed of lipid bilayer membrane that contain large amount of proteins similar to the cell membrane. The total surface area of this structure is, in some cells, the liver cells, for example, can be as much as 30 to 40 times the cell membrane area. The detailed structure of small portions of endoplasmic reticulum is shown in figure 2.4. The space inside the tubules and vesicles is filled with endoplasmic matrix, a watery medium that is different from the fluid in the cytosol and outside the endoplasmic reticulum. Electron micrographs show that the space inside the endoplasmic reticulum is connected with the space between the two membrane surfaces of the nuclear membrane. Substances in some parts of the cell enter the space of the endoplasmic reticulum and are then directed to the parts of the cell. Also, the vast surface area of this reticulum and multiple enzyme systems attached to its membrane provides the mechanism for a major share of cells' metabolic functions. Ribosomes and the rough endoplasmic reticulum. Ribosomes and the rough granular endoplasmic reticulum. Attached to the outer surface of many parts of the endoplasmic reticulum are large number of minute granular particles called ribosomes. Where these particles are present, the reticulum is called the rough granular endoplasmic reticulum. The ribosomes are composed of a mixture of RNA and proteins. They function to synthesize new protein molecules in the cell, as discussed later in this chapter and in chapter 3. Smooth granular endoplasmic reticulum. Part of the endoplasmic reticulum has no attachment to ribosomes. The part is called smooth or a granular endoplasmic reticulum. The smooth reticulum functions of the synthesis of lipid substance for other processes of the cell promoted by intracellular enzymes. Golgi apparatus. The Golgi apparatus shown in figure 2.5 is closely related to the endoplasmic reticulum. It has membranes similar to those of a smooth endoplasmic reticulum. The Golgi apparatus is usually composed of 4 or more stacked layers of thin endoplasmic vessels lying near one side of the nucleus. This apparatus is prominent in seratory cells, where it is located on the side of the cell from which secretory substances are excreted. These Golgi apparatus function in association with the endoplasmic reticulum, as shown in 2.5. Smooth endoplasmic reticulum matrix, Golgi apparatus from endoplasmic reticulum, and transport small transport vesicles, also called endoplasmic reticulum vessels, continually pitch off some of the endoplasmic reticulum and shortly thereafter fuse with the Golgi apparatus. Golgi apparatus functions in association with the small endoplasmic reticulum is as shown in small transport vesicles, also called endoplasmic reticulum vesicles, continually pitch off from the endoplasmic reticulum and shortly thereafter fuse with the Golgi apparatus. Pitch of endoplasmic reticulum vesicles. In this way, substances entrapped in endoplasmic vesicles are transported from the endoplasmic reticulum to the Golgi apparatus. The transport substances are then processed in the Golgi apparatus to form lysosomes, secretory vesicles, and other cytoplasmic components discussed later in this chapter. Golgi apparatus to form lysosomes. Lysosomes shown in figure 2.2 are vesicle organelles that form by breaking off from the Golgi apparatus. They then thus disperse throughout the cytoplasm. The lysosomes provide an intracellular digestive system that allows the cell to digest the following: damaged cellular structures, food particles that have been indigested by the cell, and unwanted matter such as bacteria. Lysosomes are different in various cell types but are usually 120 to 250 to 750 nanometers in diameter. They are surrounded by typical lipid bilayer membranes and are filled with large number of small granules, 5 to 8 nanometers in diameter, which are protein graded of as many as 40 different hydrolase digestive enzymes. A hydrolytic enzyme is capable of splitting an organic compound into 2 or more parts by combining hydrogen from a water molecule with one part of its component and combining hydroxyl protein of water molecule with other part of the compound. Hydroxyl portion of the water molecule with another compound. For example, protein is hydrolyzed by amino acids. Glycogen is hydrolyzed by glucose. Protein is hydrolyzed by amino acids. Glycogen is hydrolyzed by glucose, and lipids are hydrolyzed to form fatty substances. The amino acids form hydrolyzed to form amino acids. Glycogen is hydrolyzed to from glucose, and lipids are hydrolyzed to from fatty acids and glycerol. Hydrolytic enzymes are highly concentrated in lysosome. Ordinary, some substances around the lysosome prevents the enclosed hydrolytic enzyme from coming out in contact with other substances in the cell, and therefore prevents the digestive actions. However, some conditions of the cell break the membrane of lysosomes, allowing release of the digestive enzymes. These enzymes then split the organic substance with which they come in contact with small, highly diffusible substances such as amino acids and glucose, and some of the specific functions of lysosomes are discussed later in this chapter. Paroxysomes. Paroxysomes are physically similar to lysosomes, but they are often different in two important ways. First, they are believed to be formed by self-replication or perhaps by budding off from the smooth endoplasmic reticulum rather than from the Golgi apparatus. Secondly, they contain oxidase rather than hydrolase. Several of the oxidase are capable of combining oxygen with hydrogen ions derived from different intercellular chemicals to form hydrogen peroxide. Hydrogen peroxide is a highly oxidizing substance and is used in ice association with catalase, another oxidase enzyme present in the large quantities in paroxysms. To oxidize many substances that might otherwise be poisonous to the cell. In example, about half the alcohol that a person drinks is detoxified into acetaldehyde by the paroxysms in the liver cells in this manner. A major function of paroxysms in this catabolytic long chain fatty acid secretory vesicles. One of the important functions of many cells is secretion and special chemical substance. Almost all the secretory substances are formed by the endoplasmic reticulum Golgi apparatus system and are then released from the Golgi apparatus into the cytoplasm in the form of storage vesicles called secretory vesicles or secretory granules. Figure 2.6 shows the typical secretory vesicles inside pancreatic acinian cells. These vesicles are protein proenzymes, enzymes that are not yet activated. The proenzymes are secreted later through the outer cell membrane into the pancreatic duct and then into the duodenum. The membrane secreted later through the membrane and then pancreatic duct through the duodenum, where they become activated and perform digestive functions on the food in their interstitial tract. Mitochondria. The mitochondria shown in figure 2.2 and figure 2.7 are called the powerhouse of the cell. Without them, cell would be unable to extract enough energy from nutrients, and essentially all cellular functions would cease. Mitochondria are present in all areas of each cell cytoplasm, but the total number of cells varies from less than 100 up to several thousand, depending on the energy requirement of the cell. Cardiac muscle cells, cardiomyocytes, for example, use large amount of energy and have far more mitochondria than fat cells, adipocytes, which are much less active and use less energy. Furthermore, the mitochondria are concentrated in those portions of the cell responsible for the major share of its energy metabolism. They are also variable in size and shape. Some mitochondria are only a few thousand nanometers in diameter and are globular in shape, whereas others are elongated and are as large as 1 micrometer in diameter and 7 micrometers long. Still others are branching and filamentous. The basic structure of the mitochondrion shown in figure 2.7 is composed mainly of two lipid bilayer protein membranes, an outer membrane and inner membrane. Many unfolding of the inner membrane from some cells of tubules called cristae into two oxidative enzymes are attached. Many infolds of the inner membrane form shelves or tubes into cristae into which oxidative enzymes are attached. The cristae provides a large surface area for the mitochondrial reactions to occur. In addition, the inner cavity of the mitochondria is filled with a matrix that contains large quantities of dissolved enzymes necessary for extracting energy from nutrients. These enzymes operate in association with oxidative enzymes on the cristae to cause oxidation of nutrients, thereby forming carbon dioxide and water and at the same time releasing energy. The liberated energy is used to synthesize a high energy substance called adenosine triphosphate. ATP is then transported out of the mitochondrion and diffuses through the cell to release its own energy wherever it is needed for performing cellular functions. The chemical details of ATP formation by the mitochondrion are provided in chapter 68, but some basic functions of ATP in cell are introduced later in this chapter. Mitochondria are cell replicative, which means that mitochondria can form a second one, a third one, and so on whenever the cell needs an increased amount of ATP. Indeed, the mitochondria contains a DNA similar to that found in cell nucleus. In chapter 3, we will see what DNA is the basic constituent of the nucleus that controls replication of the cell. The DNA of the mitochondria Gion plays a similar role, controlling replication of the mitochondrial cells that are faced with increased energy demands. For example, a skeletal muscle subject to chronic exercise training may increase the density of chondria to supply the additional energy required. Amino acids and glucose, some of the specific functions of lysosomes, are discussed later in this chapter. Peroxisomes are especially similar to lysosomes, but they are different in two important ways. First, they are believed to perform self-replication. Peroxisomes. Cell skeleton, filament and tubular structures. The cell skeleton is a network of fibrillar proteins organized into filament or tubules. These organelles as precursors proteins synthesized by ribosomes in the cytoplasm. The precursor molecules that polymerize to form filamentous. Figure 2.8. As an example, large number of actin microfilaments frequently occur in the outer zone of the cytoplasm called the ectoplasm to form a elastic support of the cell membrane. Also in muscle cells, actin and myosin filaments are organized into a special contractile machine that is the basis of muscle contraction as discussed in chapter 6. Intermediate filamentous are generally strong rope-like filaments that are often work together with microtubes, providing strength and support for the fragile tubulin structures. They are called intermediate because their average diameter is between that of a narrower actin filaments and wider myosin filaments found in the muscle cells. Their functions are mainly chemical and they are less dynamic than actin filaments or microtubules. Intermediate filaments are generally strong rope-like filaments that often work together in microtubules, providing strength and support for the fragile tubulin structures. They are called intermediate because their average diameter is between the narrow actin myosin filaments and wide myosin filaments. They are called intermediate because their diameter is between narrow actin microfilaments and wider myosin microfilaments found in muscle cells. Their functions are mainly mechanical and they are less dynamic than actin microfilaments or microtubules. All cells have intermediate filaments, although the protein substance of this structure vary depending on the cell types. Specific intermediate filaments found in various cells include desmin filaments in muscle cells, neurofilaments in neurons, and keratins in epithelial cells. A special type of stiff filament composed of polymerized tubulin molecules is used in all cells to construct strong tubular structures. The microtubes shows typical microtubes of a cell. Another example of microtube is the tubular skeletal structure of the cell. Of each cellum that radiates upward from the cell cytoplasm to the tip of the cilium. This structure is discussed later on the chapter figure 2 to 8. Also, both the centrioles and microspheres of the cell undergo mitosis are composed of stiff microtubes. A major function of microtubes is to act as a cytoskeleton, providing rigid physical structure for certain parts of the cell. The cell cytoskeleton not only determines cell shape but also participates in cell divisions, allows cell to move, and provides a track-like system that directs the movement of the organelles in the cells. Microtubules serve as the conveyor belts for the intracellular transport of vesicles, granules, and organelles such as mitochondria. Nucleus. The nucleus is the control center of cells and sends messages to the cell to grow and mature, replicate, or die. Briefly, the nucleus contains large quantities of DNA, which compromises the genes. The genes determine the characteristics of the cell proteins, including the structural proteins as well as intracellular enzymes that control cytoplasmic nuclear activities. Genes also control and promote cell reproduction. The genes first produce to create two identical sets of genes, then the cell splitted by a special process called endomitosis to form two daughter cells, each of which receive one of the two sets of DNA, the genes. All of these activities of the nucleus is discussed in chapter 3. Unfortunately, the appearance of the nucleus under microscope does not provide many clues to the mechanisms whereby the nucleus performs its active activities. Figure 2 to 9 shows that microscopic appearance of the interface nucleus during the period between mitosis, revealing quick staining chromatin material through the nucleoplasm. During mitosis, the chromatin materials organizes into the form a highly structured chromosome, which can be easily identified using the light microscope as illustrated in chapter 3. Membrane. The nuclear membrane, also called the nuclear envelope, is actually two separate bilayer membranes, one inside and other. The outer membrane is continuous with the endoplasmic reticulum of the cell cytoplasm, and the space between the two nuclear membranes is also continuous with the space inside the endoplasmic reticulum as shown in figure 2.9. The nuclear membrane is penetrated by several thousand nuclear pores. A large complex of proteins are attached at the edge of the pore, so that the central area of each pore is usually 9 nanometers in diameter. Even this size is large enough to allow molecules up to a molecular weight of 44,000 to pass through the reasonable ease. Molecular weight of 44,000. Nucleo and formation of ribosomes. The nuclei of most cells contain one or more highly staining structures called nuclei. The nucleus, unlike most other organelles discussed here, does not have a limiting membrane. Instead, it is simply an accumulation of large amount of DNA and proteins of the type found in ribosomes. The nucleus enlarges considerably when the cell is actively synthesizing proteins. Formation of nuclei and the ribosome in the cytoplasm inside the nucleus brings in the nucleus. First, the specific DNA genes in the chromosomes cause DNA synthesis. Some of the synthesized DNA is stored in nuclei, but most of the transported outwards through the nuclear pores into the cytoplasm. Here it is used in conjugation with specific proteins to assemble mature ribosomes that play an essential role in forming cytoplasmic proteins discussed in chapter 3. Comparison of animal cell with cells is a complicated organism that required many thousands of years of to develop after the earliest form of life. Microorganisms that play even have been similar to present-day viruses. Microorganisms that present viruses first appears on Earth. Figure 2.10 shows the relative size of the following: the smallest known virus, a large virus, a rachia, a bacterium, and nucleated cell. Shows relative size of the following. This demonstrates that cell has a diameter about 1000 times that of the smallest virus, and therefore a volume about 1 billion times that of a smallest virus. Correspondingly, the functions and anatomical organizations of a cell are far more complex than those of virus. The essential life-giving constituents of the small virus is a nucleic acid embodied in the coat of protein. This nucleic acid is composed of this same basic nucleic acid consequence DNA and RNA found in the mammalian cell and is capable of reproducing itself under appropriate conditions. Thus, the virus propagates its lineage from generations of generations, and it is therefore a living structure is the same way the cells in humans are living structures. As life evolved, other chemicals in addition to nucleic acids and simple proteins became integral parts of the organism, and specialized functions began to develop in different parts of the virus. A membrane formed around the virus, and inside the membrane a fluid matrix appeared. Specialized chemicals then developed inside the fluid to perform special functions. Many protein enzymes appeared that were capable of catalyzing chemical reactions, thus determining the organism's activities. In still later stages of life, particularly in the archaeal and bacterial stage, organelles develop inside the organism. This presents physical structure of chemical aggregates that perform functions in a more different manner than that can be achieved by dispersed chemical throughout the fluid of the matrix. Finally, in the nucleated cell, still more complex organelles develop, the most important of which is the nucleus. The nucleus distinguishes this type of cell from all lower forms of life. It provides a control center for all cellular activities and form reproduction of new cell or generation after generation, with each new cell having most exactly the same structure as its progenitor. Functional system of the cell. In the remainder of this chapter, we discuss some functional systems of the cell that make it a living organism. Endocytosis, ingested by the cell. If a cell is to live and grow and reproduce, it must obtain nutrients over substances from the surrounding fluids. Most substances pass through the cell membrane by the process of diffusion active transport. Diffusion involves simple movement through the membrane caused by the random motion of molecules of the substance. Substances move through cell membrane pores, or in the case of lipid soluble substances, through the lipid matrix of the membrane. Active transport involves actually carrying a substance through the membrane by a physical protein structure that penetrates all the way through the membrane. These active transport mechanisms are so important to cell functions that they are represented in detail in chapter 4. Large particles enter the cell by a specialized function of the cell membrane called endocytosis. The principal form of endocytosis are pinocytosis and phagocytosis. Pinocytosis means the ingestion of minute particles of the vascule of the extracellular fluid and particular constitutes inside the cell cytoplasm. Phagocytosis means the ingestion of large particles such as bacteria, whole cells, or portions of degenerating tissue. Pinocytosis occur continually in the cell membrane of mast cells, but is especially rapid in some cells. For example, it occurs rapidly in a micrograph. That's about 3% of the total microphage. Rapidly in micrographs, 3% of total micrograph membrane is engulfed in the form of vesicle in each minute. Micro macrophages that about 3% of total macrophage membrane is engulfed in the form of vesicles each minute. Even so, the penocytic vesicles are so small, usually only 10 to 200 nanometers in diameter. Most of them can be seen only with the electron microscope. Penocytes is the only means whereby most large micromolecules such as most proteins can enter cells. In fact, the rate of which penocytic vesicles form is usually enhanced with which macromolecules attach to the cell membrane. Figure 2.11 demonstrates the successive steps of penocytosis A to D, showing the molecules of protein attaching to the membrane. These molecules usually attach to specialized protein receptors on the surface of the membrane that are specific for the type of protein that to be absorbed. The receptors generally are considered in small pits of the outer space of the cell membrane called coated pits. On the inside of the cell membrane beneath these pits, it is a lattice work of fibrillar proteins called catherine, clathrine, proteins called clathrine, as well as other proteins, perhaps including contractile contractile filaments of actin and myosin. Once the protein molecules have bonded with the receptors, the surface properties of local membrane change in such a way that the entire pit invaginates inward, and fibrillar proteins surrounding the invaginated pit cause its two borders to close over the attached proteins, as well as over a small amount of extracellular fluid. Immediately thereafter, the invaginated portion of the membrane breaks away from the surface of the cell from a penocytic vesicle inside the cytoplasm of the cell, what causes the cell membrane to go through the necessary contortions to form penocytic vesicles. That it is unclear. The cause of the cell membrane to go through the necessary conditions to form penocytic vesicles, it is unclear. The process requires energy from within the cell, which is supplied by ATP, a high energy substance discussed later in this chapter. This process also requires the presence of calcium ions in the extracellular fluid, which probably reacts with the contractile protein filaments beneath the coated pits of provides the force for pinching the vesicles away from the cell membrane. Phagocytosis. Phagocytosis occurs in much of the same way as penocytosis, except that it involves large particles rather than molecules. Only certain cells have the capability of phagocytosis, notably tissue macrophages and some white blood cells. Phagocytosis is initiated when a particle such as a bacterium, dead cell, or tissue debris bind with receptors on the surface of the phagocyte. In the case of bacteria, each bacterium is usually already attached to a specific antibody. It is the antibody that attaches the phagocytosis receptors, dragging the bacteria along with it. This intermediation of antibodies is called ozonization, which is discussed in chapters 34 and 35. Ozonization. Phagocytosis occurs in the following steps. The cell membrane receptors attach to the surface ligands of the particle. The cell membrane attaches to several particles. The edges of the membrane around the points of attachment evaginate outward within a fraction of a second to surround the entire particle. Then, progressively, more and more membrane receptors attach with the particle glands. All this occurs suddenly, like a zipper like manner, to form a closed phagocytic vesicle. Actin and myosin, contractile fibers in the cytoplasm, surround the phagocytic vesicle and contract sound and contract around its outer edge, pushing the vesicle to the interior. Actin and other contractile fibers of the cytoplasm surround the phagocytic vesicle and contract around it. Contract around it. The contractile proteins then pinches the stem of the vesicle to complete the vesicle separated from the cell membrane, leaving the vesicle in the cell interior in the same way the pinocytic vesicles are formed. Lysosomes digest pinocytes and phagocytic foreign substances inside the cell. Almost immediately after a pinocytic or phagocytic vesicles appear inside a cell, one or more lysosomes become attached to the site and empty their acetaldehydrolase to the inside of the vesicle as shown in figure 2.10. Thus, a digestive vesicle is formed inside the cell cytoplasm in which the vesicle hydrolyzes began hydrolyzing the proteins, carbohydrates, lipids, and other substances in the vesicle. The products of digestion are small molecules of substances such as amino acid, glucose, and phosphate and can diffuse through the membrane of the vesicle into the cytoplasm. What is left to the digestive vesicle called the residual body represents the indigestible substance. In most cases, the residual body is finally excreted through the cell membrane through a process called exocytosis, which is especially the opposite of endocytosis. Thus, pinocytic and phagocytic vesicles containing lysosomes can be called digestive organs of the cell. Lysosomes and regression of tissue and autolysis, the damage of cells. Tissues of the body after regress into a smaller size. For example, this regression occurs in the uterus after pregnancy, the muscle during long periods of inactivity, and the mammary glands. At the end of location, lysosomes are responsible for much of regression. Another special role of lysosomes is the removal of damaged cells, of damaged portions of the cells from tissues. Damage to the cell caused by heat, cold, trauma, chemicals, or many other factors include lysosomes to rupture. This released hydrolysis immediately begin to digest the surrounding organic substance. If the damage is slight, only a portion of the cell is removed, and the cell is then repaired. If the damage is severe, the entire cell is digested, a process called autolysis. In this way, the cell is completely removed, with a new cell of the same type is formed, ordinarily from mitotic reproduction of the adjacent cell to take place of the old one. The lysosome also contains bacterial agents that can kill phagocytized bacteria before they cause cellular damage. These agents include the following: lysosome, which dissolves the bacterial cell wall; lysoferin, which binds iron with other substances before they can promote bacterial growth; lysoferin acid at a pH of about 5, which activates the hydrolysis and inactivates bacterial metabolic systems. Autophagy and recycling of cell organelles. Lysosomes play a key role in the process of autophagy, which literally means to eat oneself. Autophagy is a housekeeping process thereby absolute organelles and large protein aggregates are detrained, and recycled. Worn out cell organelles are transferred to lysosomes by double membrane structures called autophagosomes, which are formed in the cholesterol invasion of the lysosomal membrane, and the formation of vesicle provides another pathway for cytosolic structures to be transported into the lumen of lysosomes. Once inside the lysosome, the organelles are digested and the nutrients are reused by the cells. Our cell autophagy uh, con- contributes to the routine turn off of cytoplasmic components. It is the key mechanism for tissue development, cell survival when nutrients are scarce, the maintenance of homeostasis in the liver cells. For example, the average mitochondrion normally has a lifespan of 10 days before it is destroyed. Mitochondrion synthesis of cellular structures by endoplasmic reticulum and Golgi apparatus. Endoplasmic reticulum functions. The extensiveness of endoplasmic reticulum and Golgi apparatus in secretory cells has already been emphasized. These structures are formed primarily of lipid bilayer membranes similar to cell membranes, and their walls are loaded with protein enzymes that catalyze the synthesis of many substances required by the cell. Most synthesis begins in the endoplasmic reticulum. That products reform there are then passed on to the Golgi apparatus, where they are further proceeded before being released into the cytoplasm. First, however, let us note that specific products that are synthesized in specific portions of the endoplasmic reticulum and Golgi apparatus. Protein synthesized by rough endoplasmic reticulum. The rough endoplasmic reticulum is characterized by large number of ribosomes attached to the outer surface of the endoplasmic reticulum membrane. As discussed in chapter 3, protein molecules are synthesized within the structures of the ribosome. The ribosome extrudes some of the synthesized protein molecules directly into the cytosol. They also extrude many more through the wall of the endoplasmic reticulum to the anterior and endoplasmic vesicle and tubules into the endoplasmic matrix. Lipids synthesized by smooth endoplasmic reticulum. The endoplasmic reticulum also synthesizes lipids, especially phospholipids and cholesterol. These lipids are rapidly incorporated into the lipid bilayer of the endoplasmic reticulum, thus causing the endoplasmic reticulum to grow and more extensive. This process occurs mainly in the smooth portion of the endoplasmic reticulum to keep the endoplasmic reticulum from growing beyond its needs of the cell. Small vesicles called vesicles are transfer vesicles continually break away from the smooth reticulum. Most of these vesicles then migrate rapidly to the Golgi apparatus. Other functions of endoplasmic reticulum. Other significant functions of the endoplasmic reticulum, especially the smooth reticulum, include the following. It provides the enzymes that control and glycogen breaks down when glycogen is not used for energy. It provides a vast number of enzymes that are capable of detoxifying substances such as drugs that are managed to damage the cell. It achieves detoxification by processes such as coagulation, oxidation, hydrolysis, and conjugation with glycuronic acid. Golgi apparatus functions. Synthesis functions are the Golgi apparatus. Throughout, a major function of the Golgi apparatus is provided additional process of substances already formed in the endoplasmic reticulum. It was also synthesized certain endoplasmic reticulums that cannot be formed in the endoplasmic reticulum. This is especially true for the formation of large saccharide monomers bound with a small amount of protein. Important examples of hyaluronic acid and chondroitin sulfate. Process of endoplasmic secretion by Golgi apparatus, formation of vesicles. Merges of major functions of endoplasmic reticulum and Golgi apparatus. As substances are formed in the endoplasmic reticulum, especially proteins, they are transported through the tubular outwards portions of the smooth endoplasmic reticulum that lie nearest to the Golgi apparatus. At this point, transport vesicles composed of a small envelopes of smooth endoplasmic reticulum continually break away and diffuse to the deepest layer of the Golgi apparatus. Inside these vesicles are synthesized proteins and other products from the endoplasmic reticulum. The transport vesicles instantly fuse with the Golgi apparatus and empty their contained substances through the vascular space of the Golgi apparatus. Here, additional carbohydrate moieties are added to the secretions. Also, an important function of the Golgi apparatus is to compact the endoplasmic reticular secretion into highly concentrated pockets. As the secretion passes through the outmost layer of the Golgi apparatus, the compactation and process of proceeds. Finally, both small and large vesicles continually break away from the Golgi apparatus, carrying with them compacted secretory substances and diffuse throughout the cell. The following example provides an idea of the timing of the process. When a granular cell is bathed in amino acid, newly formed protein molecules can be detected in the granular endoplasmic reticulum within 3 to 5 minutes. Within 10 minutes, newly formed proteins are already present in the Golgi apparatus, and within 1 to 2 hours, the proteins are secreted from the surface of the cell. Types of vesicles formed by the Golgi apparatus: secretory vesicles and lysosomes. In a highly secretory cell, the vesicles formed by Golgi apparatus are mainly secretory vesicles containing proteins that are secreted through the surface of the cell membrane. These secretory vesicles first diffuse to the cell membrane and then fuse with it and empty their substances to the exterior by the mechanism called exocytosis. Exocytosis in most cases is stimulated by entry of calcium ions into the cell. Calcium ions contract with the vascular membrane and cause its function with the cell membrane, followed by the exocytosis, opening of the cell membrane's outer surface and extrusion of its contents outside the cell. Some vesicles, however, are destined for intracellular use. Use of extracellular vesicles to repel cellular membranes. Some intracellular vesicles formed by the membranes of intracellular structures such as mitochondria and even the endoplasmic reticulum. This function increases the expanse of these membranes and replenish cell membrane substance. In summary, the membranous system of endoplasmic reticulum and Golgi apparatus are highly structurous and secretory substances to be extruded from the cell. The mitochondria extract energy from nutrients. The principal substance from which cells extract energy are foods that react chemically with oxygen, carbohydrate, fat, and proteins. In the human body, essentially all carbohydrates are converted to glucose by the digestive tract and liver before they reach the other cell of the body. Similarly, proteins are converted into amino acids and fat are converted into fatty acids. Figure 2.15 shows oxygen and foodstuffs, glucose, fatty acids, and amino acids all entering the cell. Inside the cell, they react chemically with oxygen under the influence of enzymes that control the reactions and chemicals. The energy released in the proper direction. The details of all these digestive and metabolic functions are provided in chapter 63 to 60, 63 to 73. Briefly, most all of these oxidative reactions occur inside the mitochondria, and the energy that is released is used to form the high energy compound ATP. Then ATP, not the original food, is used throughout the cell to energize almost all the subsequent intracellular metabolic reactions. Formation of adenosine triphosphate ATP in the cell, showing most of the ATP is formed in the mitochondria. Functional characteristics of adenosine triphosphate. ATP is nucleotide composed of the following: 1 nitrogen base adenine, the pentose sugar ribose, and 3 phosphate radicals. The last two phosphate radicals are connected with the remainder of the molecule by high energy phosphate bonds, which are represented in the formula shown in the symbol under. Chemical conditions. Each of the body contains about 1200 calories of each per mole ATP. One ATP releases energy, the phosphoric acid radical is split away and adenosine diphosphate is formed. This released energy is used to energize many of the cell's other functions, such as synthesis of substances or molecular contraction. To reconstitute the cellular ATP is as it is used up, energy derived from the nuclear nutrients cause ATP phosphate to repeat this over, and for this reason ATP has been called the energy currency of the cell membrane. Can be split and formed continually, having a turnover time for a few minutes. Chemical process of the formation of ATP. Role of mitochondria. On their entry to the cell, glucose is present in glycolysis. Small amount of ADP is charged into ATP by energy released during the conversion, but this amount occurs for less than 5% of overall energy metabolism of the cell. About 95% of cells ATP formation occurs in the mitochondria. The pyruvate acid derived from the carbohydrate, fatty acids, and lipids, amino acids from the proteins is eventually converts into component acetyl coenzyme A in the matrix of mitochondria. This substance in turn further dissolves, forced into extracting its energy by another series of endoplasmic mitochondrial matrix undergoing dissolution in a sequence of chemical reactions, which is citric acid and carb cycle. These chemical reactions are important as they are explained in detail chapter 68. In the citric acid cycle, acetyl CoA is split into its component part, hydrogen atoms and carbon dioxide. The carbon dioxide diffuses out of the mitochondria and eventually out of the cell. Finally, it is excreted from the body through the lungs. The hydrogen atoms, conversely, are highly reactive. They combine with oxygen and have also diffused into the mitochondria. Thus, combination releases a tremendous amount of energy, which is used by the mitochondria to convert large amounts of ADP and ATP. The process of this is complex during endoplasmic cells. This overall process formation of ATP is called the chemostatic mechanism of ATP formation. The chemical and physical details of these mechanisms are presented in chapter 68. Many of the details of metabolic functions ATP of the body discussed in chapter 68 through chapter 72. Use of ATP cellular functions. Energy from the ATP is used to promote the three major categories of cellular functions: transport of substances through multiple cell membranes, synthesis of chemical compounds through the cell, and mechanical work. These uses of ATP are illustrated by examples of 6.2.16. To supply energy for the transport of sodium through the cell membrane. to promote synthesis by the ribosomes and to supply the energy needed during metabolic interactions. In addition to the membrane transport of sodium, energy from ATP is required for the membrane transport potassium, calcium, magnesium, phosphate, chloride, and chloride, urate, and hydrogen as other cells, as well as various organic substances. Membrane transport is also important to cell functions that some cells of the renal tubule cells, for example, use as much as 80% of the ATP they form on the purpose alone. In addition to synthesized proteins, cells break down high energy bonds. Thus, many thousands of ATP molecules must release their energy as each protein molecule is formed. Indeed, some cells use as much as 75% of all ATP formed in the cell simply to synthesize new chemical compounds, especially protein molecules. In this particularly true during the growth of phase of the cells. Another use of ATP is to supply energy for special cells to perform mechanical work. We discuss in chapter 6 the control of muscle fibers with the expenditure of large quantities of ATP energy. Other cells perform mechanical work in other ways, especially by ciliary and embryonic motion. Described later in this chapter, the source of energy for all of these types of mechanisms work is ATP. In summary, ATP is readily available to release its energy rapidly. However, it is needed in the cell to replace ATP used by the cell. More than 95% of this ATP is formed in the mitochondria, which is why the mitochondria are called the powerhouse of the cell. Locomotions of the cell. Most obvious types of cells in the body is that occurs in the skeletal cardiac smooth muscle cells, which constitute 50% of the entire body's mass. The specialized functions of these cells are discussed in chapter 6 through 9. The two other types of movement, amoeboid locomotion and ciliary movement, occur in other cells. Functions, chapter 6 to 9. The two other types of movements, amoeboid locomotion and ciliary movement, occur in other cells. Amoeboid movement. Amoeboid movement is a crawl-like movement of an entire cell in relation to its surroundings, such as movement of white blood cells through white throat tissues. This type of movement gets its name from the fact that the amoeba moves in this manner, and amoeba have provided an extra tool for studying the phenomenon. Typically, amoeboid locomotion begins with the protrusion of a pseudopodium from an end of the cell. The pseudomodium projects away from the cell body and partially secures itself a new tissue area. Then the remainder of the cell is pulled towards the pseudopodium. Demonstrate this process, showing an elongated cell, the right hand of the which protruding pseudopodium. The membrane of this end of this cell is continually moving forward, and the membrane of the left hand of the cell is continually following along the cell moves. Mechanisms of amoeboid locomotion shows the general principle of amoeboid locomotion. Basically, this results from the continual formation of new cells. Types of cells that exhibit amoeboid locomotion. The most common cells of exhibit amoeboid locomotion in the human body are white blood cells. Control of amoeboid locomotion and chemotaxis. An important inherent amoeboid locomotion process occurs is called chemotaxis substance. Some cells move away from the source, which is called negative chemotaxis. How does chemotaxis control direction of the locomotion? Cilia and ciliary movements. There are two types of cilia, motile and non-motile, and primary cilia. Motile cilia can undergo whip-like movement on the surface of the cell. This movement occurs mainly in two places of the human body: on the surface of the uterine tubes, fallopian tubes of the reproductive tract in the nasal cavity of lower respiratory airways. In the whip-like motion of motile cilia causes the layer of mucus to move at the rate of 1 centimeter of the pharynx. In this way, continually cheering these pathways, mucus and having become trapped in mucus. This in the uterine tube cilia cause slow movements of fluid from the ostium of the uterine tube towards the uterine cavity. This movement of fluid transport of the ovum from the ovary of the uterus. As shown in figure 6 to 18, a cilium has the appearance of a sharp pointed straight curved hair projects 3 to 4 centimeters from the surface of the cell. Often many motile cilia projects from the single cell, for example, as many as 200 cilia on the surface of each epithelial cell inside the respiratory passageways. The cilium is covered by an outcropping of the cell membrane and is supported by 11 microtubules. 9 double tubules located around the periphery of the cilium, 2 single tubules down the center, as demonstrated in the cross sections of show. The figmented end of the flagellum of a sperm is similar to the motile cilium. In fact, it has much the same type of structure, the same type of console mechanism. The flagellum on the flagellum, however, is much longer and moves continuous waves instead of whip-like movements. In the inner figure, 2.8 movements of motile cilium is shown 10 to 20 times per second. Mechanism of ciliary movement. Also, not all ciliary movement are found called exoname. Crawl. Non-motile primary cilia serve as cell sensory antennae. Primary cells are non-motile and generally occur only as a single cilia on each cell. Although the physiological functions of primary cells are not understood, current evidence indicates that they function as sensory antennae. Defects in signaling in primary cilia and renal tubule epithelial cells are thought to contribute to various disorders, including the development of large fluid filled cysts, a condition called polycystic kidney disease. Skeleton of the thorax. The thoracic cage is formed by the body's 12 thoracic vertebrae in their inverted disc and 12 pairs of ribs and their costal cartilages on the sides. The ribs are formed by the largest contribution of the thoracic cage. Identify the first feature. The first, a full circular facet in the upper part of the side of the body for complete articulation with the head of the first rib, and the demicostal facet for the lower part of the body for articulation with the part of the head of the second rib. The body is small and curvature in type because the transverse diameter is broader than the anterior posterior diameter. Superior vertebral notch is prominent unlike typical vertebra due to the presence of posterolateral lipping of the upper surface of the body. The superior notch transmits the 8th cervical nerve. The superior notch transmits the 8th cervical nerve and the inferior notch transmits the first thoracic nerve. 8th cervical nerve and first thoracic nerve. The vertebral foramen is large and triangular for a accommodation of the lower part of the cervical elongator of the spinal cord. A spinous process is long and horizontally directed. 9 thoracic vertebra. It is similar to typical vertebra except for the following. It possesses an upper demicostal facet on the side of the body for the head of the 9th rib. Demicostal, but usually the lower demicostal facet is missing because the head of the 10th rib articulates only with the costal facet on the body of the 10th thoracic vertebra. 10th thoracic vertebra characterized as follows. It usually possesses a single costal facet on the each side of the body, close to the upper border to articulate with the head of the 10th rib, along with costal facets on its transverse process to articulate with the tubercles of the 10th rib. Its body is large and assumes the shape of a lumbar shape. 11th thoracic rib. Its body presents on each side a singular costal facet which proceeds somewhat from the upper border and articulates fully with the head of the 11th rib. Transverse process do not bear costal facets since the 11th rib is floating. The inferior articular facets like typical vertebra are flat and face forwards and medially. 12th thoracic vertebra. It is thrice unique. The enlarged lumbar type of the body presents a fully circular costal facet and on each side articulates with the head of the 12th rib. The costal facet particularly lies in the midway between the upper and the lower border of the body and encroaches the pedicle. Each transverse process is devoid of costal facet because the 12th rib is floating. The transverse process is small and presents three tubercles, superior, lateral, and inferior. The superior and inferior tubercles correspond respectively to the medullary and the accessory tubercles in the lumbar process, and the lateral tubercle represents its true transverse process. Lateral represents its true transverse process. Lumbar vertebra. The inferior articular facets are convex. Inferior articular facets are convex and twisted forward and laterally like that of a lumbar vertebra. The ribs are flat ribbon-like elastic bony arches that extend from thoracic vertebra posteriorly to the lateral borders of the sternum anteriorly. Their anterior ends are connected to the costal cartilage. The ribs, along with its costal cartilage, constitute the costa. The ribs and their costal cartilages form greater part of the thoracic skeleton. Numerically, there are 12 pairs of ribs, but the occurrence of accessory cervical or lumbar may increase them to 13 pairs, and absence of 12th rib may reduce them to 11 pairs. Arrangement and general outline. The ribs are arranged one below the other, and the gaps between the adjacent ribs are called intercostal space. The length of ribs increase from the first to 7th rib and then gradually decrease. Hence, 7th rib is the longest rib. The transverse diameter of thorax increases progressively from the first to the 8th. Hence, the 8th rib has the greatest lateral projection. The ribs are arranged obliquely, that is, their anterior ends lies on the lower level than their posterior ends. They are arranged obliquely. Their obliquity of the ribs increases progressively from first to the 9th rib. Hence, the 9th rib is the most obliquely placed. The width of the rib gradually reduces from above to downwards. Anterior ends of the first 7 ribs are connected to the sternum through their sternal cartilages. The cartilages at the sternum ends of 8, 9, and 10 ribs are joined to the next costal cartilage. The anterior ends of the 11 and 12 ribs are free, therefore they are called floating ribs. The 10th rib usually have free anterior ends in Japanese. The first rib slopes down along its entire extent. The middle of each costal arch, consisting of rib and its costal cartilages, except the first rib, lies at a lower level than a straight line joining the two ends of the costa. Classification according to features: typical ribs, 3rd to 9th, atypical ribs, the 1st, 2nd, 10th, 11th, and 12th. The typical ribs have the same general features, whereas the atypical ribs have special features and therefore can be differentiated from the remaining ribs. According to relation with the sternum, true rib, the 1st to 7th, the upper 7 ribs, the false ribs, 8 to 12th, the lower 5 ribs. true ribs articulate with the sternum anteriorly, whereas false ribs do not articulate with the sternum anteriorly. According to articulation, vertebrosternal ribs 1st to 7th, vertebrochondral ribs 8th to 10th, vertebral floating ribs 11th to and 12th. The vertebrosternal ribs articulate posteriorly with vertebrae and anteriorly with sternum. The vertebrochondral ribs articulate posteriorly with the vertebra and anteriorly with their cartilaginous joint, the cartilages of higher rib. The vertebral and the floating ribs articulate posteriorly with their vertebra, but their anterior ends are free and attached to small pieces of hyaline cartilages. Typical ribs parts. Each rib has three parts: anterior, posterior, and shaft. The anterior end bears a concave depression. The posterior end consists of head, neck, and tubercle. These are typical ribs. The shaft is the longest part, extends between the anterior and the posterior ends. It is flattened and twisted. It has inner and outer surface, upper and lower borders. It is curved with convexity directed outwards and bears a costal groove on its inner surface near the lower border. 5 centimeters away from the tubercle, if it abruptly changes its direction. This is called the angle of the rib. Site termination and anatomical position. The site of the rib can be determined by holding it in such a way that the posterior end, having a head, neck, and tubercle, is directed posteriorly. Its concavity faces medially. Its sharp border is directed inferiorly. It is in an anatomical position. The posterior end is higher and nearer the medial plane than the anterior end. Features and attachments. Anterior costal. It bears a small cup-shaped depression that joins the corresponding costal cartilages to form a primary cartilaginous joint. Tubercle, articular, non-articular part, neck, head, angle of rib, oblique line, oblique surface, shaft, inner surface, above, par border, costotransverse and costovertebral. Posterior end. It presents the head, neck, and tubercle. Posterior end. Head. It has two articular facets, lower and upper. The lower larger facet articulates with the body of the numerical corresponding vertebra. The upper smaller facet articulates with the next higher vertebra. The crest separates the two articulates. The articular facets lie opposite to the intervertebral disc. Intra-articular ligament attaches in the crest. Neck. It lies in front of the intervertebral disc is secondary cartilaginous joint. In front of the transverse process of the corresponding vertebra, it has two borders, superior and inferior. The neck has two borders, superior and inferior, and two surfaces, anterior and posterior. The upper border is sharp crest-like, whereas the lower border is rounded. The posterior surface is rough and pierced by the foramina. Tubercle. It is situated on the outer surface of the rib. Outer surface of the rib at the junction of the neck and the shaft. It is divided into two parts, medial articulator part and lateral non-articulator part. The articular part bears a small oval facet that articulates with the transverse process of the corresponding vertebra. The non-articular part is rough and provides attachment to the ligaments. The lateral costotransverse ligament. Shaft. It is thin and flattened. Presents two surfaces, outer and inner, two borders, upper and lower, and two angles, posterior and anterior. Borders. Superior border. The superior border is thick and rounded and presents an outer and inner lip. The outer lip gives attachment to the external intercostal muscle. The intercostal lip gives attachment to the internal intercostal muscle and intercostalis intimus muscle. Lower border. The lower border is sharp and forms the lower board of the costal groove. The lower border is and gives origin to the external intercostal muscle. Surfaces. Outer surface. It is smooth and convex and presents two angles, posterior and anterior. The posterior angle, generally called the only angle, is marked by the oblique ridge. The anterior angle is marked by an indistinct oblique line. Inner surface. It is smooth and concave. It presents a costal groove near the lower border. The costal groove becomes unrecognizable in the anterior part. The costal groove lodges into the intercostal nerve, lodges, lodges the intercostal nerve from above downward, and it is following manner: intercostal vein, intercostal artery, and intercostal nerve. Note well, three characteristic features of the typical rib. It is thin, flat, long, and curved along its entire extent. It has inner and outer surface. It is angulated. That is prevents two bends, one 5 cm in front of the tubercle and 2 cm behind the anterior end. It is twisted on long axis so that the two ends of the ribs cannot touch the same horizontal plane. Typical rib. First rib. It is shortest, broadest, and the most acutely curved. Its shaft is flattened above the downward so that it has upper and lower surfaces and outer and inner borders. The shaft is flattened above downwards. So it has the upper and the lower surfaces and outer and inner borders. The head is small, rounded, bears a single circular articular facet to articulate with the side of the first thoracic vertebra. The angle and tubercle coincide. It has no costal groove and its lower intercostal on its lower surface. The neck is rounded and elongated. It is directed upwards, backwards, and laterally. Its anterior end is larger and thicker. Note well, the shaft of the first rib slopes obliquely downward forward to its sternal end. It is due to its obliquity that the pulmonary and the pleural apexes project into the root of the neck. Slight determination. Side of the neck can be determined by holding the rib in such a way that its larger end is directed interiorly and its smaller end is directed posteriorly. The surface of its shaft, having two groups separated by a ridge, is directed superiorly, and its concave border is directed inward and its convex border is directed outward. Trick for students for side determination. For the first rib, keep the rib on the table on considering its position on your own body. Now, note that the rib belongs to the side on which its both ends touch the surface. If the ribs is placed on the wrong side, then only the anterior will be touching the surface. Tubercle net hack articular facet angle. Scalene tubercle. Scalene tubercle. Posterior groove ridge and the anterior groove. Tubercle angle. The sympathetic chain, first posterior intercostal vein, superior intercostal artery, ventral ramus of the first thoracic nerve. Scalenus medius. Scalenus medius serratus anterior. Scalenus anterior. Lower branch of the bronchi plexus. Subclavian artery. Subclavian vein. Costo. Subclavicular muscle. Serratus anterior. Scalenus anterior. Costoclavicular ligament. Features and attachments. Inner border. It presents a scalene tubercle about its middle. Tubercle and adjoining part of the upper surface provides an attachment to the scalenus anterior muscle. It provides attachment to the Simpson's fascia, suprapleural membrane, outer border. It provides origin to the first digitation of the serratus anterior about its middle. First digitation of the serratus anterior and behind the group of the first subclavian cavity. Superior upper surface. It is crossed obliquely by two shallow grooves, an anterior and posterior. separated by a slight ridge. The ridge is continuous with the scalene tubercle. The scalene. Two shallow grooves, an anterior and posterior, separated by a slight ridge. The ridge is continuous with the scalene tubercle. The anterior groove lodges subclavian vein, while the posterior groove lodges the subclavian artery and lower trunk of the brachial plexus. The area behind the posterior groove up to the costal tubercle provides attachment to the scalenus medius muscle. The posterior groove up to the costal tubercle provides attachment to the scalenus medius muscle. The area in front of the anterior groove and near the anterior end provides attachment to the subclavian muscle and costoclavicular ligament lower surface. It is located to the costal pleura neck. It is elongated and directed upwards, backwards, and laterally. The following structure from anterior relations of the neck from medial to lateral: sympathetic chain, first posterior intercostal vein, superior intercostal artery, ventral ramus of the first thoracic nerve, second rib. Distinguishing features and attachments: its length is twice the size of the first rib, twice that of a first rib. Its shaft is sharply highly curved. The angle is slight and located close to the tubercle. Its shaft is not twisted, hence both ends of the rib touch the tabletop point based on it. Near its middle, the outer convex surface of the shaft presents a rough tuberosity which provides attachment to the serratus anterior muscle, lower part of the first, whole of the second digitation. The outer surface of the shaft is convex and faces more upwards and outwards. The inner surface of the shaft is concave and faces more downwards and inwards. Posterior part of the interior surface presents a short costal groove. The upper border and adjoining part of the upper surface provides attachment to the scalenus posterior and serratus posterior muscles. 10th rib. Distinguishing feature: it has a single facet on its head which articulates with the body of the corresponding thoracic vertebra. It is slightly shorter than the typical rib. It is short rib and pointed inner end. It has large single articular facet on its head. It has no neck and no tubercle. Its anterior end is pointed and tipped with the cartilage. It has straight angle and shallow costal groove. Its inner surface is directed upward and inward. 10th rib. Distinguishing features: the 12th rib has the same features as the 11th except that it has no angle, no costal groove. It's much shorter than the 11th. Such determination: the 8th rib can be determined by keeping the rib in such a way that its pointed anterior end is directed anteriorly and the border of ends posteriorly. Its slightly curved surface faces inward and upward. Its sharper border is directed inferiorly. Attachments: outer surface. Near the tip, it provides attachment to the latissimus dorsi muscle near the tip and above the external oblique muscle. Below, its medial half provides attachment to the erector spine muscle. Inner surface: an oblique line crosses the middle of the surface mark on the line pleural reflection crosses the medial of the surface marks. The lower part of the medial half provides attachment to the quadratus lumborum muscle. The middle 4 quarters near the upper border provides attachment to the internal intercostal muscle. The upper part of lateral 1/4 near the tip provides attachment to the diaphragm. Atypical features: 11, 12 rib. 11 rib. Rib is 6 inches length, no curvature. It is 11 rib, 5.5 inches length, no curvature. A small knife neck handle. Single angle, no angle. Short group, no coastal group. Inner surface faces slightly upwards, vertebral crossover. Lower border close to the head. It provides attachment to the lumbroscotal ligament with stretch from the transverse process of lumbar 1 ligament. Lateral arcuate ligament and is attached to it just lateral to the quadratus lumborum. Upper border. Upper border provides attachment to the external and internal intercostal muscle. The typical features of 11-12 ribs are summarized in table 16.1. Ossification of the ribs. All the typical ribs ossify from 4 centers. 1 primary center for all the shape near the ankle, 3 secondary centers on the head for the articular part of the tubercle and for the non-articular part of the tubercle. Primary center appears in the 8th week of IUL. Secondary centers of all ribs appear in the puberty. Fusion of all these ribs occurs at the age of 20. Ossification of some atypical ribs. The first rib is ossified by the 3 centers. The 1 primary center for the 2 centers for the head of the tubercle. 11th and the 12th ribs are ossified by 2 centers. Clinical correlation. Cervical rib. The cervical rib may elongate and about in 5% of individuals. Lumbar rib develops coastal lip, vertebra. Fractures of the lip. Note 12. Fracture of the rib in children as the ribs are elastic and the fracture of the rib is rare as the children is elastic on them. The first and second ribs are protected by the clavicle and the last 2 ribs belong to mobile floating hands. They are rarely injured. Flaying chest or stove chest. When the ribs is fractured at the 2 sides and anteriorly and under the flaying chest occurs, the flaying segments of the ribs are soaked in during inspiration and pushed outward during expiration, leading to a clinical condition called paradoxical respiration. Atypical ribs. First rib. Distinguishing features. It is shortest, broadest, and most acutely curved. Its shaft is flattened above downwards so that it has the upper and the lower surface. Its shaft is flattened above and downwards, upper and lower surface, and outer and thinner borders, and outer and inner borders. Its head is small, rounded, and bears a single circular articular facet to articulate with the side of the first thoracic vertebra. Its angle and tubercle coincide. Its angle and tubercle coincide. It has no coastal groove on its lower surface. Its neck is rounded and elongated. It's directed upwards, backwards, and laterally. Its neck is elongated. Its neck is rounded and elongated. It is directed upwards, backwards, and internally. Its interior end is larger and thicker. Larger and thicker. Note 12. The shaft of the first rib slopes obliquely down and forward to its sternal end. It is due to its obliquity that the pulmonary and the pleural apex projects into the root of the neck. It is due to its obliquity that the pulmonary and pleural apex projects into the root of the neck. Site determination. Site of the rib can be determined by holding the rib in such a way that its larger end is directed anteriorly and its smaller end is directed posteriorly. The surface of the shaft have 2 grooves separated by a ridge. Is directed superiorly, and the surface of its shaft having 2 grooves separated by a ridge is directed superiorly, and its concave border is directed inward, and its convex border is directed outward. 2 grooves separated by a ridge is directed superiorly, and its concave border is directed inward, and its convex border is directed outward. Note 12. Trick for students for side termination of the first rib. Keep the rib on a table top considering its position in your own body. Now note that the rib belongs to the side on which its both ends touch the surface. If the rib is placed on the wrong side, then only its anterior end will be touching the surface. It has a articular facet, a head, a neck, angle, tubercle, posterior groove, the ridge, and the anterior groove. It has sympathetic chain, the first posterior intercostal vein, superior intercostal artery, ventral ramus of T1 spinal nerve, scalenus medius, serratus anterior, scalenus medius, serratus anterior, lower trunk of branchial plexus, subclavian artery, subclavian vein, subclavian muscle, costoclavicular ligament. First rib seen from above. General features and attachments and relations. Features and attachments. Inner border. It presents a inner border. It presents a scalene tubercle about its middle. Tubercle and adjoining part of the upper surface provides attachment to the scalenus anterior muscle. It presents a scalene tubercle about in the middle. Adjoining the part of the upper surface provides attachment. Upper surface provides attachment to the scalenus anterior muscle. It provides attachment to the Simpson's. It provides attachment to the Simpson's fascia, suprapleural membrane, outer border. It provides origin to the first digitation of serratus anterior. About its middle. Origin to the disease about its middle. And behind the groove for the first subclavian artery. Superior upper surface. It is crossed obliquely by two shallow grooves, anterior and posterior, separated by a slight ridge. The ridge is continuous with the scalene tubercle. With the scalenus tubercle. The anterior groove lodges subclavian vein. While posterior groove lodges subclavian artery and lower trunk of the branchial plexus and lower trunk of the branchial plexus. The area behind the posterior groove up to the costal tubercle provides attachment to the scalenus medius muscle. The area behind the posterior groove up to the costal tubercle provides attachment to the scalenus medius muscle. The area in front of the anterior groove and near the anterior provides attachment to the subclavius muscle and costoclavicular ligament. Lower surface. It is related to the costal pleura. Neck. It is elongated and directed upwards, backwards and laterally. The following is structure from anterior relations of the neck from the medial to the lateral side. The sympathetic chain, first posterior intercostal nerve, superior intercostal artery, ventral ramus of the first thoracic nerve. Thoracic vertebrae. There are 12 thoracic vertebrae. They are identified by the presence of costal facets on the sides of their bodies for articulation with the head of the ribs. These articulations are the characteristics of thoracic vertebrae, as they are not found in cervical, lumbar, and sacral vertebrae. The size of the thoracic vertebrae increases gradually from above downwards. These bodies of the upper thoracic vertebrae gradually changes from the cervical to the thoracic type, and those of lower pneumothoracic from lumbar type. Thus, the body of the T1 vertebrae is typically cervical, and the type of that of thoracic 12 vertebrae is especially lumbar in type. The presence of articular facet on the side of the body, the cardial features of the thoracic vertebrae. Note well, the presence of articular facets on the side of the body is the cardinal feature of thoracic vertebrae. Classification. According to features, the thoracic vertebrae are classified into two types: typical and atypical. From 2nd to 8th are the typical, and 5th and 9th and 12th are the atypical. Typical thoracic vertebrae characteristic features: presence of articular facets on each side of the body. Body is heart-shaped, particularly in the mid-thoracic region when viewed from above. This transverse and anterior-posterior measurement are almost equal. Vertebral foramen is circular. Spinous processes are long, cylinder, and angulated downwards. Transverse process is prominent and bears an articular facet for articulation with the rib. Pedicles are attached to the upper part of the body, thus making the inferior vertebral notch. The pedicles are attached to the upper part of the body, thus making the inferior articular notch. The thoracic vertebrae consist of two pairs, body and vertebral arch. The body and vertebral arch enclosed a vertebral foramen in which lies the spinal cord. The body and the vertebral arch enclosed a vertebral foramen in which lies the spinal cord, surrounded by its meninges. Body. It is heart-shaped when viewed from above. Its anterior, posterior, and transverse dimensions are almost equal. On each side, the bodies have two costal facets, superior and inferior. On each side, the bodies have two costal facets, superior and inferior. Superior facet is larger and situated near up the border of the body. Superior facet in front of the root of the pedicle. The inferior facet is smaller and situated near the lower border in front of the inferior notch. Body. Inferior facet is smaller and situated near the lower border in front of the inferior vertebral notch. Vertebral arch. It consists of a pair of pedicles anterior and two lamina posterior. Vertebral arch. It consists of a pair of pedicles anterior and two laminae posterior. Two pedicles anterior and two laminae posterior. The pedicles right and left are short, rounded, bony bars which project backwards and laterally from the posterior aspect of the body. The laminae right and left, each pedicle continues posterior medially. The laminae posterior laterally as a vertical plate of bone. The laminae of the two sides join with each other in the posterior midline. The spinous process arises in the midline, where the two laminae meet posteriorly. Two transverse processes, one on either side, arises from the junction of the pedicle and lamina. Two transverse processes, one on either side. Two paired articular processes, one on each side, spring from the lamina. The superior articular process projects rather more from pedicle than the lamina. The inferior articular process springs from a lamina. Note well, each vertebra has 7 processes: paired transverse process, paired superior articular process, paired inferior articular process, and single spinous process. 7 processes: paired Transverse process, paired transverse process, paired superior articular process, paired inferior articular process, and a single spinous process. Features and attachments. Body. The upper larger costal facet, actually demifacet, articulates with the head of the numerically corresponding rib, and the lower smaller facet, actually demifacet, articulates with the head of the next rib. Anterior and posterior lingual ligaments. Anterior and posterior surface of the body provides attachment to the anterior and posterior lingual ligaments respectively. These ligaments are attached to both the upper and the lower borders of the body. Posterior surface of the body is marked by vascular foramen for vestibular veins. These are covered by the posterior lingual ligament. Pedicles. They are attached nearer to the superior border of the body. As a result, the superior vertebral notch is shallow and the inferior vertebral notch is deep. They are attached to the superior border. Pedicles. Notch. The deep inferior vertebral notch together with the small superior vertebral notch of the next of the lower vertebra completes the transverse foramen through which the spine nerves leaves the vertebral canal. Laminae. They are short, broad and thick, and they overlap each other from above downwards. Their margins provide attachment to ligamenta flava. Superior articular process. The articular facets on the superior articular process are directed backward and slightly laterally and articulate with the inferior articular facet of the next higher vertebra. Directed backward and slight laterally and articulate with the inferior articular facet of the next higher vertebra. Superior articular process. Inferior articular process. The articular facets on the inferior articular process is flat and faces forward and little downward and medially. It articulates with the superior articular facet on the next lower vertebra. Transverse process. They are large cube-shaped and projects laterally and slightly backwards. They are large cube transverse process. The facet on the anterior aspect of the tip of the transverse process articulates with the tubercle of the numerically corresponding rib. They provide attachment to the ligament and muscle related to the rib cage and back. Spine. The spines are directed backward and downward. The spinous process of the middle four vertebrae, i.e. from 5th to 8th, are very long, vertical and overlap each other. The spinous process of upper 4 and lower 4 vertebrae are relatively short and less oblique than in direction. Figure 16.9 showing backward and downward inclination of the spinous process of the thoracic vertebra. Note well, the spinous process of the T1 vertebra is the most prominent and more or less horizontal its projection and can be palpated at the back of the neck just below the lower end of the medial notch furrow. The spinous process of the T8 vertebra is the longest. The backward shunt decreases at the 11th vertebra. The backward shunt decreases at the 11th vertebra. The spine is directed most downward. It is termed the anticlinal vertebra. Below this level, spines slant sharply backward and slant decreases at the level of the 11th vertebra. Slightly dorsally, the spinous provides attachment to the supraspinous and infraspinous ligaments. Note well, the spines of the middle 4 thoracic vertebrae are the most vertical. Atypical thoracic vertebrae. First, thoracic vertebrae. Distinguishing features. The body of the vertebrae resembles that of a cervical vertebrae, viz. C7 vertebra. The body is heart-shaped. It is narrow anterior-posteriorly. Its upper surface is concave from outside to side, with an upward projection lip on either side. The anterior border of the inferior surface projects downward. The superior costal facet on side of the body is circular and articulates with the whole of the facet on the head of the first rib. The superior vertebral knots are deep, for example, clearly seen as in the cervical vertebra. The inferior costal facet on the side of the body is half demifacet, articulates with the head of the second rib. The spinous process is thick, long, and nearly horizontal. Atypical features. Type 1 body cervical type, superior facet on the side of the body circular, superior costal facet on the side of the body circular, deep supravertebral notch, long, more or less horizontal spine. Only superior costal demifacet on the side of the body. Only superior large facet, semilunar oval on the side of the enroaching and upper part of the pedicle. T11 only side articular costal facet on the side of the body extending on the floor of the pedicle. No articular facet on the transverse process. T12 resembles L1 vertebra. Transverse process is small with 3 tubercles. No articular facet, no transverse process, only single large costal facet on the side of the pedicle. Articulate facet on inferior articular process inverted. 9 thoracic vertebrae. Distinguishing features. Lower facet of each body is absent. The body of itself process of vertebral facet. 10 distinguishing features. 11 distinguishing features. 12 thoracic distinguishing features. Here, distinguishing features of atypical ribs. Distinguishing resembles the 7 vertebra T9, T10, T11, and T11. Ossification of typical vertebra. Note 12. According to some authorities, the body of the vertebra is considered a modified long bone because centrum of the vertebral body is comparable with the diaphysis and the annular epiphysis of the ends of the long bone. Lesion of the thoracic spine. Compression fractures of the vertebral bodies. Metastatic spinous tumors, tuberculosis, cold abscess, and sclerosis of thoracic spine and kyphosis. Ossification of the typical thoracic vertebrate ossifies in cartilage by 8 centers. 3 primarily and 5 secondarily. 3 primarily and 5 secondarily. The 3 primary centers are one on each half of the vertebral arch near root and one from the centrum. They appear around second month, 8 to 9 weeks of the fetal life. The 5 secondary centers, one for tip of the spine, one each for transverse process, one each for plates of cartilages, on upper and lower surface of the body. They appear at the puberty and fuse with the rest of the body at 25 years of age. Thus, the centers in the upper and the lower plates of cartilages on the upper and the lower surfaces of the body form a ring of bone around the central cartilaginous plate of the vertebral body. Occasionally, the body centrum gets ossified to 2 centers, and if one center fails to develop, it will lead to hemivertebra. This may cause scoliosis. Typical thoracic vertebra. The first thoracic vertebra. Distinguishing features. The body of vertebra resembles that of cervical vertebra. For example, cervical 7 vertebra. The body is heart-shaped. It is narrow anteriorly. The body is heart-shaped. It is narrow anteriorly. Its upper surface is concave from side to side with an upward projection lip on either sides. The anterior border of the inferior surface projects downward. The superior costal facet on the side of the body is circular and articulates with the whole facet on the head of the first rib. The superior vertebra notches are deep, for example, clearly seen as a cervical vertebra. The inferior costal facet on the side of the body is half, for example, demifacet, and articulates with the head of the second rib. The spinous process is thick, long, and nearly horizontal.
Thoracic vertebra. The distinguishing feature, the known costal facet on each side of the body is absent. Lower costal facet on bones বের করে দেখো. The body on
The lower costal facet on each side of the body is absent.
The body on each side process only superior costal facet, demifacet for articulate with the ninth rib. 10 thoracic vertebra. The body on each side process.
Distinguishing features.
The body on each side process only a single articulate vessel, which is similar or oval for articulation.
Semilunar or oval.
Similar or oval for articulation with the 10th rib. The costal vessel encroaches on the upper part of the pedicle.
11 thoracic vertebra. Distinguishing features.
Body on each side process a single large circular costal facet for articulation with the head of the 11th rib. The costal facet extends onto the root of the pedicle. Transverse process are small and don't process a costal facet on their tips of the articulate with tubercle of the 11th rib, as 11th rib has no tubercle.
12 thoracic vertebra. Distinguishing features. It is largest and the most inferior of thoracic vertebra. It is largest and the most inferior of the thoracic vertebra. It resembles the first lumbar vertebra. Body on each side possesses a large single costal facet that is more on the lower part of the pedicle than on the body. Large single costal facet. Transverse process is small and presents 3 tubercles, superior, middle, and inferior. It has no articular facet, as 12th rib has no tubercle. The 3 tubercles of the transverse process of the 12th vertebra correspond with the following process of the lumbar vertebra. Superior tubercle corresponds with mammillary process of the lumbar vertebra. Superior tubercle corresponds. Middle tubercle corresponds to the true transverse process of lumbar vertebra. Inferior tubercle corresponds to the accessory process of the lumbar vertebra. Articular facet on inferior articular process, everted lumbar type. The important distinguishing features of the typical thoracic vertebra, for example, 1st, 9th, 10th, 11th, 12th, are enumerated in table 16.2.
Thoracic 12 vertebra is bifid naki bifid
Hybrid
hybrid vertebra with anatomical feature of both thoracic and lumbar vertebra. This is among the most susceptible vertebra to damage from the compression, or often called the transition vertebra, due to its proximity of lumbar vertebra, partly to process feature of both thoracic and lumbar vertebra.
For distinguishing features of typical thoracic vertebra distinguishing features. T1 resembles the 7th cervical vertebra. Superior costal facet is circular. Superior vertebral notch is deep and clearly seen. 9. Possess only superior demifacet. 10. Present only one single complete facet. Presence of 11 of a large singular costal facet. Absence of any articular facet on the transverse process. Resembles the first lumbar vertebra. Presence of a single large circular facet extending into the root of the pedicle. Transverse process presents Three tubercles, superior, inferior, and lateral. Articular faces on the inferior articular process, everted lumbar type. Half of vertebral, natural arch, primary center, centrum, and figure 16.11.
Primary center of observation of a typical thoracic vertebra. Vertebra at birth consists of three bony parts. Occipation of the typical thoracic vertebra. It ossifies in cartilage by the 8 centers, 3 primary, 5 secondary. 3 primary centers are one of each half of the vertebral arch near root and one of the centrum. They appear around second month, 8 to 9 weeks of fetal life. 5 secondary center, one or tip of spine, one or each transverse process and one or each for plates of cartilage on upper and lower surface of the body. The upper appear at about puberty and fuse with the rest of the body by 25th year of age. The center in the upper and lower parts of the cartilage on the upper and lower surface of the body form a ring of bone around the central cartilaginous place of the vertebral body. Occasionally, the body centrum gets ossified by 2 centers, and if one center fails to develop, it will lead to hemivertebra. This may cause the scoliosis. Note book
Note well.
According to some authorities, the body of the vertebra is considered as the modified long bones because centrum of the vertebral body is comparable to the diaphysis and annular epiphysis to the ends of a long bone.
Clinical correlation. Lessons of thoracic spine. Lessons of thoracic spine.
Lesions of thoracic spine, compression or fracture of the vertebral bodies due to the fixed position for being attached to ribs.
Compression fracture of the vertebral bodies.
Due to the fixed position for being and attached to ribs. The metastatic spinal tumors due to the spread of cancer cells from the breast and the prostate.
Metastatic spinal tumors due to the spread of cancer cells from breast to the prostate.
The tuberculosis and the cold abscess. It most common in the lower thoracic and upper lumbar vertebra. Scoliosis of
most common in lower thoracic and upper lumbar vertebra.
Scoliosis of the thoracic spine and abnormal lateral curvature of spine. Kyphosis. It is excessive curvature of the thoracic spine. This is forward bending of the back. Kyphosis.
Interpretation. Benedict test is a semi-quantitative test where the color of participant roughly parallels the concentration of reducing sugar in simple urine. Blue, amount of sugar. Qualitative. Blue, 0. Green, 0.5 gram percent. Or yellow, 1%. Orange, 1.5%. Red, 2%. Brick red, 2%. Brick red, more than 2%. Reducing substance in urine. Presence of any one of the urine will give positive Benedict test. Sugar and not carbohydrates. Glucose, homogenetic acid. Fructose, salicylates are lactose, ascorbic acid. Galactose and pentose. Glycosidic bond. Monosaccharides are connected with each other through glycosidic bond to form disaccharide, polysaccharide, and other complex carbohydrate. Glycosidic bond. Carbohydrate can also be connected with other non-carbohydrate alcoholic substance called glycogen through glycosidic bond to form glycosides. Glycosidic bonds between sugars are named according to the number of connected carbons and also with regard to the position of anomeric hydroxyl group of the anomeric carbon participating in the bond. For example, C1 anomeric carbon of the glucose if bonded with C4 of another glucose, the bond will be named as 1,4-glycosidic bond. If the OH group of C1 anomeric carbon is alpha form, and bond will beta 1,4-glycosidic bond. C1 anomeric carbon is one of the glucose. If bonded with C4 of another glucose, the bond will be named as 1,4 glycosidic bond. If the OH group of C1 anomeric carbon is in alpha form, a bond with be alpha 1,4 glycosidic bond. If the OH group of C1 anomeric carbon is in beta form, it will bond with beta 1,4 glycosidic bond. Anomeric if B form is beta glycosidic bond. Alpha D glucose 1 alpha D glucose C1 and 1,4 glycosidic bond alpha 4 glucose. Alpha D galactose and alpha D glucose 1,4 glycosidic bond. In polymers of alpha D glucose, for example, starch glycogen glucose units are connected by alpha 1,4 glycosidic bond, whereas in polymers of beta D for example cellulose glucose units are connected by the beta 1,4 glycosidic bond. In human enzymes for carbohydrate digestion can break 1,4 glycosidic bond, not the B variety. So cellulose is non-digestible for us. Glycosides are substances produced by condensation of cyclic monosaccharides with alcoholic group of another second compound. Formation of cyclic monosaccharide involves bonding between functional group containing anomeric carbon of fifth carbon. It makes cyclic hemiacetal of aldose or cyclic hemacetal of ketose. Second compound providing OH group may be another monosaccharide or any other non-carbohydrate substance. If the second compound providing OH group is monosaccharide, the resulting glycoside becomes disaccharide. Non-carbohydrate substances also can provide OH group as second compound to make glycosides. These non-carbohydrate substances are collectively called aglycone. Commonly, aglycones are methanol, esterol, glycerol, phenol, etc. D-glucose, hemiacetal cyclic form, alpha D-glucose, acetyl glycic form. Cyclic forms hemiacetal, hemiacetal of monosaccharides are unstable. They provide the OH group of the anomeric carbon to make bonds with another alcohol OH group of a second compound to form stable cyclic structure called acetal of aldose or ketal of ketose. These acetyl or ketal substances are known as glycosides. Common glycosides are cardiac glycosides. It contains sterol and aglycol. It inhibit NK pump is used in heart failure treatment as a cardiac stimulant. Streptomycin, erythromycin, these are used as antibiotics. Oabin, inhibitor of Na plus and Ka plus pump. Florazine, block glucose absorbent in intestine. Complex carbohydrate amino sugar with amino NH2 group attached with usually a second carbon. For example, glucosamine, galactosamine, manosamine, found in glycoprotein, mucopolysaccharide and glycolipid. And acetylated amino sugar with NH2 group and second carbon and acetyl group NH3 COOH carbon attached with Na2 group, found in glycoprotein, glycolipid and mono and glycopolysaccharide. For example, acetyl glutamine, salic acid and acetyl acid manosamine with pyruvate attached to the first carbon. It is found in glycoprotein and galactosides, mucopolysaccharides, carbohydrate parts of glycoprotein. Mucose substances, macromolecules and containing sugar. Characteristics of macro substances: composed of carbohydrate and protein, whitish, viscous and slippery. Mucose substances, strongly negative and hydrophobic. Types of mucose substances: glycoprotein, mucoprotein. Here protein is the dominant part, glycoprotein is the dominant part, carbohydrate is a minor part, less than 15% by weight, and carbohydrate part is usually a short oligosaccharide chain. proteoglycan. Here protein presents a minor part, but carbohydrate presents dominant part up to 95%. 15% by weight, minor part carbohydrate, but carbohydrate is up to 95% weight. And the carbohydrate part of the proteoglycan is known as mucopolysaccharide. So the carbohydrate part of proteoglycan is known as mucopolysaccharide, MPS. Carbohydrate part of proteoglycan or glycosaminoglycan. Function, importance of mucopolysaccharide, MPS, and glycosaminoglycan. Components of extracellular matrix, synovial fluid, vitreous humor, and mucus, etc. Act as biological lubricant to provide protection against mechanical injury and microbial invasion. For example, focus of mucous and respiratory tract, GIT, and urogenital tract contains mucous substances and protects the body from microbial invasion. Mucus of alimentary tract allow easy slippage of food from the mouth to intestine. Mucous substances in joint space in different potential space prevent mechanical injury. Functions, importance of glycoprotein. Components of the extracellular matrix, ground substance of connective tissue, act as biological lubricant to provide protection against mechanical injury and microbial invasion. For example, mucous substances in joint space and in different potential space prevents mechanical injury. Cellular recognition and cell-to-cell interaction serve as cell surface receptor, cell surface antigens, for example blood glucose substance, enzyme, hormone, antibody, and structural protein, etc. Difference between mucopolysaccharide and carbohydrate of glycoprotein. Mucopolysaccharide, MPS, and carbohydrate part of glycoprotein. Mucopolysaccharide, long chain heteropolysaccharide, short chain heteropolysaccharide, mostly unbranched, highly branched, consist of repeating disaccharide units made of amino sugar, for example glucosamine, acetic acid, uronic acid. Don't have repeating disaccharide units made of hexose, acetyl aminohexose, proteose, and salicylic acid. Contain uronic acid, gluconic acid, but not salicylic acid. Contain salicylic acid but not uronic acid. Contain acid sugar, contain no acid sugar. Biological importance, functions of carbohydrate. Glucose, chief source of energy. Glucose derived from dietary carbohydrate is the main fuel of the body. Glycogen produced from glucose acts as important storage for energy in the body. Helps in protein and fat metabolism. Helps nucleic acid synthesis by providing ribose. Act as protein and fat sparer. Presence of glucose spare protein and fat from of oxidation catabolism. Precursor of synthesis of glycoproteins, proteoglycans, and glycolipids. Consist of structural components of biological membrane and receptor, intercellular ground substance matrix, and biological lubricant. Involved in detoxification of toxic substances in liver by producing gluconic acid. Importance, functions of cellulose. Advantages: prevents constipation and maintains regular bowel habit. Facilitates cholesterol excretion, keeps serum cholesterol low, and reduces the risk of coronary artery disease. Prevents the risk of obesity, diabetes, mellitus, and chronic cancer. Disadvantages: it prevents the intestinal absorption of minerals. Disadvantages: lactulose and its importance. Lactose is a disaccharide of galactose and glucose joined by 1B14 glycosidic bond. Galactose, disaccharide of galactose and fructose. Galactose is non-digestible in human but digested by bacteria. Lactulose is used as a lactative in clinical medicine. Hexose of physiological importance. Sugar, glucose, main source of energy. Fructose, components of sugar, common sugar, Galactose, components of lactose, glycolipid and glycoprotein. Mannose, components of glycoprotein, mucoprotein. Classification of carbohydrates. They are classified as follows: monosaccharides, disaccharides, oligosaccharides, and polysaccharides. Monosaccharides, simple sugar, cannot be hydrolyzed into further simple form. For example, glucose, fructose, galactose, mannose, ribose, etc. Disaccharides yields two or same or different monosaccharides on hydrolysis. Sucrose, maltose, and lactose, etc. Yields 3 to 10 some or same or different monosaccharides on hydrolysis. For example, maltotriose, ribonose, and raffinose. Polysaccharide yield more than 10 or same or different monosaccharides on hydrolysis. For example, starch, glycogen, and cellulose. On the basis of number of carbons: triose, tetrose, pentose, hexose, heptose. Aldose, glyceraldehyde of glycerols. Glyceraldehyde or glycerose. Glyceraldehyde. Dihydroxyacetone. Glyceraldehyde, dihydroxyacetone. Erythrose, erythrulose. Ribose, ribulose. Glucose, fructose. Glucoheptose and sadoheptose. According to nature of content: homopolysaccharides, heteropolysaccharides. Homopolysaccharides are starch, dextrine, cellulose, and glycogen. Heteropolysaccharides are heparin, hyaluronic acid, and chondroitin sulfate. Properties of carbohydrate, monosaccharide, and glucose. Physical properties: water soluble, crystalline, colorless, sweet in taste, except polysaccharide. Water soluble except polysaccharide. Optically active, shows isomerism and mutarotation. Chemical properties: derivatives of polyhydric alcohol. Reducing power due to the presence of aldehyde and ketone groups, monosaccharides and disaccharides except for sucrose and trehalose act as reducing agent in alkali media, but polysaccharides have no reducing power. Properties of carbohydrate and monosaccharide glucose. Physical properties: water soluble, crystalline. Ketone, aldehyde and ketone derivatives of polyhydric alcohol. Due to the presence of aldehyde and ketone groups, monosaccharides, the disaccharides act as reducing agent in alkali media, but polysaccharides have no reducing power. Example: Cu2 plus reducing sugar equal to Cu plus and sugar acid. Oxidation. On oxidation, monosaccharides produce sugar acid. For example, hexonic acid. Hexoronic acid. That is hexation of alcohol containing. C. Glucose, gluconic acid. Fructose, fructonic acid. Galactose, galactonic acid. Reduction. Monosaccharides are reduced to their corresponding alcohols by reducing agents such as amalgam. For example, reducing monosaccharides. Glucose, alcohol sorbitol. Mannose, mannitol. Defructose sorbitol plus mannitol. Ribose, sorbitol. So glucose is sorbitol, glucose and fructose and mannose and fructose is mannitol. Oxazone formation. All reducing sugars combine with phenyl dihydrazine and produce oxazone crystal. For example, glucose phenyl dihydrazine is glucose or phenyl dihydrazine equals to glucosazone, needle shaped glucosazone. Ester formation. Sugar by virtue of the alcohol group from ester and acids. Ester formation. Sugar by virtue of alcohol groups. Ester formation. Glucose plus ACP equal to glucose 6-phosphate ester plus ADP. Glucose plus H3PO4. So glucose ATP plus ATP समान glucose 6-phosphate ester ATP. Fermentation. Sugars are fermented to O2 and ethanol by yeast and bacteria. Glycoside formation. Glycosides are formed when the hemiacetal and hemical OH group anomeric carbon of CHO reacts with the OH group of another CHO or non-CHO or methanol. Examples of glycosides. Glycosides galactose streptomycin. The bond is formed by the called glycosidic bond, and the non-carbohydrate moiety when present in glycerol is referred as a glycone. Ring structure. Sugars not only remain stretched but also ring shaped, maybe 6-membered pyranose and 5-membered amino sugars from amino group plus sugar, amino group plus glucose one and glucosamine, amino group plus sugar one amino sugar. Condensation. Simple sugars condense to form polymers called polysaccharides. Give biochemical importance of carbohydrates. Biochemical importance biochemical importance of CHO. Biochemical importance CHO. Chief source of energy. Glucose equal to 4.1 kilocalorie per gram. Important storage form of energy. Glycogen. Helps in protein and fat metabolism. Helps in nucleic acid synthesis by ribose and deoxyribose. Helps in nucleic acid synthesis. Ribose and nucleus acts as protein sparer and anti-ketogenic. Helps as protein sparer and anti-ketogenic. Precursor for synthesis of lipid, amino acid, glycoprotein, and proteoglycans. Constitute the structural components of cell membrane. Give energy to sperm. Fructose. Mention the biochemical importance of monosaccharide. Glucose, galactose, fructose, disaccharide, polysaccharide, and lactose. Monosaccharide, glucose, galactose, fructose, disaccharide, polysaccharide, and lactose. Biochemical importance of different form of CHO. Monosaccharide. Glucose is a ready source of energy. Glucose is the major fuel for the tissue of mammal except ruminants. Glucose is the universal fuel for fetus. Glucose is also food for brain, RBC, cardiac muscle, and retina. Glucose is converted into glycogen, which is the reserve source of energy. Glucose gives energy to sperm. Galactose is produced in mammary glands to make lactose of milk. Galactose is component of glycoprotein of glycolipids. Mannose is the component of glycoproteins. Ribose and deoxyribose is the essential component of RNA and DNA respectively. Diseases associated with monosaccharides are diabetes mellitus, galactosemia. Glucose prevents ketosis. Disaccharides, sucrose, lactose, and maltose are hydrolyzed into monosaccharides, which are absorbed and metabolized and they give energy. Sucrose, lactose, and maltose are hydrolyzed into monosaccharides, which are absorbed and metabolized and give energy. Lactose is the sugar of milk. Diseases associated with disaccharides are lactose intolerance, sucrose intolerance, etc. Sucrose is the most commonly used table sugar supplying calories. Polysaccharide. Starch is the major source of energy in the diet. Starch. Glycogen is the storage form of energy. Glucose increases the bulk of intestinal contents, which stimulates peristalsis and helps in defecation, preventing constipation. Hyaluronic acid serves as a lubricant and shock absorbent in joints. It also promotes wound healing. The heparin, a mucopolysaccharide, acts as anticoagulant. Inulin is used for measurement of GFR. Some glycosides are used for drugs, such as cardiac glycoside, streptomycin. Glycoproteins and glycolipids are the structural components of cell membrane. Diseases associated with polysaccharides are glycogen stored disease, etc. Oligosaccharide, antibody, clotting factor, and Peptide hormones contain oligosaccharides. Monosaccharide. The carbohydrates which contain single sugar unit can be hydrolyzed into further form is called monosaccharides. They are often called simple sugars, whose general formula is CnHO2n. Classification of monosaccharides. Monosaccharides is classified into basis of functional groups. They contain triose, tetrose, pentose, hexose, heptose. If they have aldose, if they have aldose, then glyceraldehyde or dihydroxyacetone. Glyceraldehyde, dihydroxyacetone. Erythrulose, erythrulose. Ribose, ribulose. Glucose, fructose. Glycoheptose or pseudoheptose. What are the different structures of glucose? The structures of glucose can be represented in three ways: a straight chain structure formula, aldohexose; a cyclic structure, Haworth projection; and six-membered ring containing one oxygen atom in front of a chair. What are the difference between aldose and ketose? Difference between aldose and ketose. Aldose and ketose. Aldose are derived from primary alcohol. Ketones are derived from secondary alcohol. Aldose contain aldehyde group. Ketose contain ketone group. Simplest form of aldose is glyceraldehyde. Simplest form of ketose is dihydroxyacetone. Commonest aldose is glucose. Commonest ketose is fructose. Commonest aldose is glucose. Commonest ketose is fructose. Example: glucose galactose. Example: fructose ribulose. Name, mention the biochemical importance of pentose sugar. Monosaccharides having 5 carbon atoms are called pentose. Their general formula is C5H2O5. Pentose. Biochemical importance, structural importance of deoxyribose, R-ribulose. Ribulose is an important R-ribonose, and R-xylose, R-xylulose, R-lysose. Illustrate in the table the importance of physiologic importance. Mention the biological importance of hexose. Occurrence and biomedical importance. D-glucose as a constitute of polysaccharide and disaccharide. Sugar fuel of life, excreted in urine and diabetes. Glucose, structural unit of cellulose in plants. D-galactose, a constitute of lactose, converted to glucose. Failure leads to galactosemia, found in plant polysaccharide and animal glycoproteins. D-mannose, for the structure of polysaccharides. From the structure of polysaccharides. D-fructose, fructose and honey as a constitute of sucrose and inulin. Its phosphates are intermediates of glycolysis. What is inversion? Invert sugar or invertase. Short note: invert sugar. Sucrose is dextrorotatory plus 6.5 degree, but when hydrolyzed, the crude mixture of glucose and fructose is formed. Fructose is strongly levorotatory, which inverts the previous dextrorotatory action of the sucrose into levorotatory minus 58.2 degrees. What is 2-deoxyribose? Deoxyribose is a deoxy sugar in which a hydroxyl group in number 2 carbon atom has been replaced by hydrogen. Ribose, 2-deoxyribose. What do you mean by sugar or non-sugar? No sugar. Substance which are water soluble, crystalline, and sweet in taste. For example, all monosaccharides, disaccharides are sugar. Substances which are water insoluble, amorphous, are polysaccharide or non-sugar. What is reducing sugar? Reducing sugar. Sugars have free aldehyde or ketone groups are called reducing sugars. They act as reducing agent in alkali media. Example, all monosaccharides and disaccharides except sucrose are reducing. Non-reducing sugars. They do not contain free aldehyde or ketone as functional group. Their functional groups are usually engaged in glycosidic bonds. Example, sucrose and all polysaccharides are non-reducing sugars. Describe. Glucose is a reducing sugar. Carbohydrates that have free functional aldehyde or ketone groups in their structure having reducing power are usually called reducing sugars. Monosaccharides and disaccharides act as reducing agent because they have free functional aldehyde and ketone groups, but polysaccharides have no reducing power. Reducing property is usually demonstrated by the Benedict test. And sugar reduced to Cu2 plus to Cu2 plus reducing sugar to Cu and sugar acid. Why sucrose is not a reducing sugar? Because sucrose is equal to glucose plus fructose. Sucrose is formed by the union of aldehyde group and glucose, aldehyde group of glucose and ketone group of fructose. Hence, it has no aldehyde or ketone group and cannot reduce any substance. This is why sucrose is not reducing sugar. Nice to know different names of sucrose: disaccharide, non-reducing sugar, cane sugar, table sugar, invert sugar. What are the color reactions for carbohydrate? Benedict test. The color reactions for carbohydrate: Benedict test, Mollis test, Bierford test, iodine test, Sally-Wanhoof's test, Dial's test, and picric acid test. Short note: Benedict's test. Cupric salt is produced by glucose is not alkali solution to cuprous salt, giving a visible color. Cupric salt is reduced by glucose in hot alkali solution to cuprous salt, giving a visible color. Benedict test: CuSO4 Na2SCO3 non-citrate produced. If I take 5 ml Benedict equivalent reagent to test tube, heat to tube over flame to expel the impurities. Observation: the color is changed depending on the present amount of reducing substance: blue, green, yellow, orange, and brick red. Interpretation. Observation: reducing substance is absent, blue, then green, yellow, orange, brick red. Write the significance of Benedict test in urine. To detect sugar urine from diagnosis of diabetes mellitus, diagnosis of ailments of renal glycosuria, to see prognosis of treatment of diabetes mellitus. Carbohydrate. List of carbohydrates of physiological significance. Carbohydrate of biological importance: monosaccharide, glucose, fructose, galactose, mannose, ribose, deoxyribose, and ribulose, etc. Monosaccharides, disaccharides, maltose, lactose, and sucrose. Polysaccharides: starch, glycogen, inulin, dextrin, cellulose, heparin, hyaluronic acid, chondroitin sulfate, and keratin sulfate, etc. Name the important dietary carbohydrates. Important dietary carbohydrates: monosaccharide, glucose, fructose, galactose; disaccharide, sucrose, maltose, and lactose; polysaccharide, starch, main source of CHO, glycogen, and cellulose. Nice to know. Sucrose and carbohydrates are widely distributed in nature. There are 3 main sources: sugars, starch, general roots, tubers, and plant stem, etc. Cellulose, vegetables, cereals, fibrous link of fruits. Nice to know. Disease associated with carbohydrate metabolism: diabetes mellitus, galactosemia, lactose intolerance, glycogen storage disease. Name of common monosaccharides with sucrose. Mention the sources of biologically important monosaccharides. Common monosaccharide with sources: D-glucose, fruit juice; D-fructose, fruit juice; D-galactose, hydrolysis of lactose; D-mannose, hydrolysis of plant and gums. Name the common disaccharides with sucrose. Common disaccharides with sucrose. Name of disaccharides and sources: sucrose, cane and beet sugar; lactose, milk; maltose, enzyme hydrolysis of starch; isomaltose, enzyme hydrolysis of starch. Factors: heated milk, trehalose, yeast, and fungi. Name the polysaccharides given in their source of function. Common polysaccharides and their sources. Name of polysaccharides. Sources: starch, inulin, cereal, inulin, dahlia bulbs, garlic, onion, etc. Glycogen, liver, muscle, brain, etc. Plants that do not possess chlorophyll, for example, yeast, fungi. Cellulose, plants, and cell wall. Chitin in the exoskeleton of some invert, for example, insects and crustaceans. Importance of polysaccharide. Polysaccharide. Polysaccharides are those carbohydrates that yield more than 10 or different monosaccharides. Class: starch, glycose, cellulose, monosaccharides, etc. Polysaccharides are of two types. Hemopolysaccharide, they contain only one type of monosaccharide unit and can be represented by a general formula: starch, glycogen, dextrin, dextran, cellulose, inulin, agar, etc. Heteropolysaccharide, they contain two or more different types of monosaccharide units and their derivatives like amino sugar, sugar acid, and mucopolysaccharides. Functions: polysaccharides provide one or more three functions: structural or mechanical, chemical, proteins, energy storage, bind water, resistance, dehydration. What is the importance of starch? Note: starch. Starch is the major food source of carbohydrate and the homopolymer of glucose, forming an alpha glucosidic chain called a glucosan or glucan source. It is the most important source of carbohydrate in our food and found in cereals, potatoes, legumes, roots, tubercles, and other vegetables. Structure: starch is a homopolymer composed of D-glucose units held by glycosidic bonds. It is a mixture of two substances. Amylose: it is water soluble and non-branched helical structure. 200 to 1000 alpha D glucose joints are jointed together by alpha 1,4 glycosidic bonds. Amylose, amylopectin, 80 to 85% is water insoluble, consists of branched chains composed of 24 to 30 glucose representing 1 to 4 glycosidic bonds. Water insoluble and water soluble. Properties: starch granules are insoluble in cold water, but when they are suspended in heated starches become soluble. Starch reacts with iodine to give blue color. Important: in the carbohydrate reserve of plants, which is the most important dietary source of higher animals, including man. Glycogens are those which yield glucose and hydrolysis. Fructose which yield fructose and hydrolysis. Dextrin are hydrolysis starch. Glycogen is the energy source of polysaccharide in animals and some called animal starch. Glycogen is the energy source of polysaccharide in animals and it is sometimes called animal starch. Sucrose: liver, muscle, brain, yeast, fungi, etc. Structure: it is a highly branched structure with chain 24 to 4 alpha D glucopyronase reduces gluconic linkage with branching by means of alpha 1,4 glycosidic bonds. Properties: it is non-reducing, readily soluble in water and gives a red color in iodine. It is non-reducing and readily soluble in water, gives a red iodine. Properties: importance of glycogen. Glycogen is the reserved source of energy in animal. It is stored in liver and skeletal muscle. Liver glycogen: during hypoglycemia, it is converted into glucose by glycogenolysis and maintains glucose level. Serves other tissues via information and blood glucose. Liver glycogen. Muscle glycogen serves as a fuel reserve for the synthesis of ATP during muscle contraction. Serves the needs of muscles only. Does not pay attention to the blood sugar level. The difference between starch and glycogen. Plant source, animal source. Mixture of amylose and amylopectin. Single polysaccharide. Less branched than glycogen. Amylose is unbranched and amylopectin is branched. Highly branched. Molecular weight about 5 lakh. Molecular weight about 10 to 40 lakh. Glycogen gives reddish violet color with dilute iodine solution. Gives deep reddish color with dilute iodine solution. Write down the biochemical importance of cellulose. Cellulose is polysaccharide of glucose units that constitutes the chief part of the cell wall of plants. It consists of beta D glucose units linked by beta 1,4 glycosidic bonds to form long straight chain strengthened by cross-linked hydrogen bonds. Cellulose consists of beta D glucose. Importance: it is a major constituent of dietary fiber. It helps in deification and thus prevents constipation. Cellulose is not digested in human body. It remains H2O in it retains H2O in the intestine due to the colloidal nature and increases the bulk of intestinal contents, thus stimulates peristalsis and causes defecation. Absorption of glucose so has a beneficial role in diabetes mellitus. Absorption of cholesterol so has a beneficial role in hypercholesterolemia. Obesity and diabetic person. Nice to know. Mammals, including man, lack any enzyme to hydrolyze B14 bonds and cannot digest cellulose, so it gives no energy. Monosaccharide in the gut of the ruminants and other herbivores can hydrolyze B linkage and ferment the products to short chain fatty acids as a major energy source. Different among starch, cellulose and glycogen. Source: plant source, animal source. Mixture of amylose and amylopectin, single polysaccharide. Branching: amylose is unbranched and amylopectin is branched. Unbranched, highly branched. Branching: amylose is an unbranched and amylopectin is branched. Glucose polymer: alpha D glucose, beta D glucose, alpha D glucose. Glycosidic bonds: 1,4,1,6, beta 1,4, alpha 1,4,1,6. Analysis: yes, no, yes. Rice, potato, wheat, vegetables, fruit, etc. Liver, muscle, brain, etc. Inulin, polysaccharide. It is a polysaccharide of fructose and hence it is called fructosan. It is found in the tuberous root of dahlias, artichokes, and dandelions. Properties: readily soluble in water. During hydrolysis, fructose is produced. It does not produce any color with iodine. Inulin does not hydrolyze into any enzyme. So, inulin. Short note: inulin. And importance of inulin used in measurement of glomerular filtration rate (GFR). Name the monomeric units of cellulose and inulin. Cellulose. Monomeric of cellulose, glucose. Monomeric of inulin, fructose. Monomeric of cellulose, glucose. Monomeric of inulin, fructose. Polysaccharide of fructose. Mucose substances. Characteristics. Name a monomeric unit for cellulose and inulin. Characteristics: whitish, viscous, strongly negative, hydrophobic, composed of hydrocarbon and protein. Glycoprotein. Here protein is the dominant part. Types: glycoprotein. Protein is the dominant part. Carbohydrate is the minor part, and carbohydrate is quite usually a short oligosaccharide chain. Proteoglycan. Here protein represents minor part, but carbohydrate represents the dominant part. Carbohydrate part of proteoglycan is known as mucopolysaccharide, and the carbohydrate part of proteoglycan is known as mucopolysaccharide or glycosaminoglycan. Mucopolysaccharide and glycosaminoglycan. What are the mucopolysaccharides? GAG is a structural unbranched polysaccharide made out of repeating disaccharides. Long branch negatively charged mucopolysaccharides are complex carbohydrates containing amino sugars and uric acids. The heteropolysaccharide situated in extracellular matrix is called mucopolysaccharide or glycosaminoglycans. Six major types: hyaluronic acid, darmatan, sulfate, chondrin, keratin, heparin, and heparin. Highly negatively charged, very much slippery, have the capability of holding large amount of water, viscosity. As ground substance, they are associated with bone, elastic, and collagen. Structure: gags are long, unbranched, heteroamino sugar acids. Carry sulfur groups except the hyaluronic acid. The polymer is linked into protein and called core protein, hence its proteoglycans. It gives a bluish battle appearance, brush battle appearance. The proteoglycans monomers attached to hyaluronic acid. Proteoglycans linked to hyaluronic acid by proteins called link proteins. Components: amino sugar, uronic acid, core protein, proteoglycans, link protein. Components: occurrence: extracellular matrix, synovial fluid, varus humor of the eye, cartilage of the bone, and anterior wall. Function: major function extracellular matrix, ground substance. Hyaluronic acid serves as lubricant, shock absorbent in joints, and promote wound healing. It gives elasticity to the substance, permitting compression and re-expansion of cartilage. It lubricates joints both in the surface and cartilage and in synovial joints. The heparin in the intracellular components most cells acts as anticoagulant. The heparin in the intracellular component of most cells acts as anticoagulant. Keratin sulfate found in blue CT and cornea. It keeps cornea transparent. Heparin sulfate is the component of basement membrane. Heparin sulfate is the component of basement membrane. Darmatan sulfate is found in skin, blood vessels, and heart vessels. Mention difference between glycoproteins and proteoglycans. Difference between glycoproteins and proteoglycans. Synonym: mucoprotein and peptidoglycan. Dominant part: protein, carbohydrate. Minor part: carbohydrate and protein. Synonym: mucoprotein and peptidoglycan. A short oligosaccharide chain, mucopolysaccharide. Glycosides. Glycosides are compounds formed by the condensation reaction between sugar and the hydroxyl group of a second compound or a glycone, which may or may not be another sugar. The bond is so formed is known as glycosidic bond. If the carbohydrate portion of the glucose is resting compound is a glycosidic. If is galactose, then it is galactoside. Glucoside to galactoside. The non-carbohydrate portion of the glycosidic is called aglycone. Aglycone may be OH containing substance such as methanol, methyl alcohol, glycerol, sterol, phenol, or sugar as disaccharides. Glycosides are compounds formed by the condensation between a sugar and a hydroxyl group of a second compound. Importance of glycosides. Glycosides are found in many drugs, spices, and in the constitute of animal tissues. Glycosides containing steroids are important in medicine because they are action of the heart. Cardiac glycosides. Some glycosides derivatives and digitalis inhibition of NK-cell membrane. Other glycosides include antibiotics such as streptomycin. Short note: amino sugar. Sugar containing an amino group is called amino sugar. Amino group D-glucose, D-glucosamine. Amino group D-galactose, D-galactosamine. Amino group D-mannose, D-mannoctosamine. Importance of amino sugar. Glucosamine is a constituent of hyaluronic acid. Galactosamine is a constituent of glycoprotein and chondroprotein. Mannose is an important constituent of mucoprotein. Several antibiotics, for example, erythromycin, carbamazepine, contain amino sugar, believed to be important for their antibiotic activity. Isomers and isomerism. Asymmetric carbon atom. Chiral carbon, the carbon atom in which 4 different atom groups of atoms are attached to a side by side to be asymmetric carbon atom. All monosaccharides except dihydroxyacetone has asymmetric carbon. For example, the star sign carbon is an asymmetric carbon. Significance of asymmetric atom. Asymmetric carbon. The carbon atom which different atoms look different. Presence of asymmetric carbon atoms allows the formation of isomers. Number of possible isomers depend on the number of asymmetric carbon atoms. The number of isomers in second to and where and the number of asymmetric carbon. Glucose with 4 asymmetric carbons has 16 isomers. Isomers are the substances having same molecular formula but different structural form, or having the same molecular structure formula but different spatial configuration. Example, ethyl alcohol and dimethyl ether are isomers. They have the same molecular formula but the structure formula but different structural formula. The existence of a chemical compound in two or more forms which have the same molecular formula but different structural formula, or same molecular structure formula but different spatial configuration, resulting in difference of physical and chemical properties is called isomerism. Molecules having same molecular empirical formula but different structural formula are called isomer to each another, and this phenomenon is called isomerism. It is due to the presence of asymmetric carbon atoms. Classification of isomerism. Molecules having same molecular formula but different structure formula is called isomer. Each other and this phenomenon is called isomerism due to the presence of asymmetric carbon atom. Isomerism. Structural isomerism, stereoisomerism. Chain, position, functional, and tautomerism. Structural. Stereoisomerism, general optical. Geometric optical. Structural isomerism. The substance having same molecular formula but different structural formula are called structural isomerism. This phenomenon is known as structural isomerism. Example, ethyl alcohol and dimethyl ether are structural isomers. Stereoisomer is a substance having same molecular structure formula but different spatial configuration. It's called stereoisomerism. Phenomenon is known as stereoisomerism. Two types: geometric isomerism. The stereoisomerism that contains at least one double bond in their molecule and differ in position of the same type of atoms group of atom around the double bond are called geometric isomerism. Phenomenon is known as geometric isomerism. It is also known as cis-trans isomerism. There are two types. Cis isomerism. If the isomers have the same types of atom groups attached to the same side of the double bond, they are called cis isomers. Trans isomer. If the isomer having same type of atoms of groups of atoms attached to different sides of double bond, they are called trans isomers. Example, cis fumaric acid, trans fumaric acid. Optical isomer. It is the phenomenon in which isomers show different optical activities due to the presence of asymmetric carbon atoms. When a beam of polarized light is passed through a solution exhibiting the optical activity, it will be rotate either on the right or the left in accordance with the type of the optical isomer which is present. A compound which causes a rotation of polarized light to the right is said to be dextrorotatory, and which causes rotation of the left, it is said to be levorotatory. For example, glucose is dextrorotatory, D and L is levorotatory. Short note: epimer is one form of stereoisomerism. If any compound contains more than one asymmetric carbon atom, the orientation of the H and OH group of particular asymmetric carbon gives rise to an isomerism called epimerism. The compounds are called epimer to each other. The epimer of glucose is 2. D-maltose and glucose 4. D-maltose, D-glucose, D-galactose. Isomerism of sugar, D and L isomer. The D and L isomers are mirror images of each other. D and L isomers are mirror images of each other. The orientation of the H group found in human. The sugar is the member of D series when it is not left in the L series. The monosaccharides which found in human are D isomers. Optical isomerism. Due to the presence of asymmetric carbon atom, sugars show optical isomerism. When a beam of polarized light is passed through the solution of optical isomer, it will be rotated in the right or left. D-glucose, dextrorotatory D-glucose, levorotatory, dextrorotatory, levorotatory. When equal amount of DL and isomers present in a solution, optical activity of isomer channels and one another, net optical activity of the solution becomes zero. This mixture is called as racemic or DL mixture. Pyranose and Frunze ring structure. Pyranose, fixed number of rings having one oxygen atom and 5 carbon atoms. Pyranose, carbon atoms. Pyranose and furanose, 5 number of ring having one oxygen atom and 4 carbon atoms. For glucose in solution, more than 99% is the pyranose form. Alpha and beta anomer. Carbonyl atom, first atom glucose is called anomeric carbon. The ring structure of glucose in solution presents in two forms, different configuration, H and H group around the anomeric carbon. These isomers are called anomers and produced by maturation. For example, alpha D glucopyronase and alpha monomer, BD glycopyronase. Avimers of glucose are mannose, D-mannose, D-glucose and D-galactose and mannose. Aldose, ketose isomerism. Isomers having the same molecular formula but different structural formula with either aldehyde or ketone group are called aldose ketose isomer. For example, both glucose and fructose have molecular formula, but glucose has aldehyde group, so it has an aldose, and fructose has ketone group, so it has ketose. So they have aldose ketose isomerism. Give difference between D and L glucose. 5 carbons on the right side, left side, and metabolize not so, and dextrose not common. Short note: anomeric carbon. Anomer differs from each other in the configuration around a carbon atom, which is called the anomeric carbon atom. Anomers differ from each other in the configuration around a carbon atom, which is called anomeric carbon atom. Location: in case of aldose, anomer carbon is a carbon one ring structure. In the ketose, anomer carbon is second carbon structure. Characteristics: anomeric carbon causes formation of alpha and beta configurations. Example: alpha D glucose, beta D glucose is different configuration of H and OH anomer carbon atoms. Alpha D glucopyranose, beta D glucopyranose. Functions: only the state of oxygen of the anomeric carbon determines if the sugar is reducing or non-reducing. Anomeric carbon causes mutarotation of a single sugar molecule. Short note: anomer. The orientation of H and OH groups around the anomeric carbon gives rise to the isomerisms called isomerism, and isomers are called isomer. For fructose, carbon 2 long is anomeric carbon. Define mutarotation: the spontaneous change in the optical orientation of the optical activity solutes that reduces a stable equilibrium value is the mutarotation. The spontaneous change in the optical rotations of optically active solutions that reaches a stable equilibrium value is called mutarotation. For example, the solution of D-glucose water exponentially produces a equilibrium mixture of 62% beta glycopyronase and 38% alpha glycopyronase. This process requires the ring structure open to linear form during the interconversion. During this process is called mutarotation. The equilibrium reached the rotation of fixed 52.7 degrees. Equilibrium mixture: beta glycopyranose and alpha glycopyranose. Simplest form of aldose, glyceraldehyde. Simplest form of ketose, dihydroxyacetone. Simple common aldose, glucose. Commonest ketose, fructose. Neutral glucose, alpha D glucose. Starch 1,4 alpha 1,6. Glycogen 1,4 1,6 alpha. Lactose beta 1,4. Maltose alpha 1,4. Sucrose 1,2. Cellulose beta 1,4. Parts of the microscope: framework, base, pillar, handle, body, stage. Focusing system: coarse adjustment, fine adjustment. Optical system: Eyepiece, nosepiece, objective. Eyepiece, nosepiece, objective. Light system. Source of light, mirror, condenser, iris, diaphragm. Types of microscope: simple microscope, compound microscope, and electron microscope. Uses: microscope is used to study fine details of biological cells and tissues. Compound microscope is used for medical diagnosis. It is also used in industrial sites. Simple microscope, compound microscope, electron microscope. Eyepiece, arm, objective, stage, clip. Coarse adjustment, fine adjustment. Light source, switch. Biocular, compound microscope. Microscope definition: preparation of tissue of the visible under light microscope is called tissue preparation. Purpose of tissue: the purpose of tissue preparation is to see the normal architecture of the cell. Steps to tissue preparation. Then there is the definition of microscope. Types of microscope. How to prepare tissue. Microscope and tissue staining. Types of microscope. Light microscope, binocular microscope, dissection microscope, dark field microscope, fluorescent microscope, phase contrast microscope, patterizing microscope, focal microscope, electron microscope, and parts of the light microscope. Then there is the purpose and the purpose microscope. Definition of microscope, types of microscope, light microscope, draw tube, optical parts. How to prepare a slide. And there is the introduction and types of microscope. There is preparation of tissue for study, fixation, embedding, and sectioning and staining. Light microscope, bright field microscope, fluorescence microscope, phase contrast microscope, confusion microscope, polarizing microscopy, electron microscope, transmission electron microscope, scanning electron microscope, autoradiography, cell and tissue culture, enzyme histochemistry, visualization of specific molecules, immunochemistry and hydrogenation, interpretation of structure of tissue section, summary of key points, and assess your knowledge. Introduction to molecular regulation and signaling. Introduction. Molecular biology has opened the doors to new ways to study embryology and enhance our understanding of normal and abnormal development. Sequencing the human gene together with creating techniques to investigate gene regulation at many levels of complexity has taken embryology to another level. Thus, the anatomical to the biochemical to the molecular level, the story of embryology has progressed, and each chapter has enhanced our knowledge. Embryonic development is directed by genomes that contain all the information required to make an individual. The information is encoded in DNA. In sequences called genes that code for proteins. In turn, proteins regulate the expression of other genes and act as single molecules to orchestrate development. There are approximately 23,000 genes in the human genome, which represents only 1/5 of the number 100,000 predicted prior to completion of Human Genome Project. Because of various levels of regulations, however, the number of proteins derived from these genes is closer to originally predicted number of genes. What has been disproved is the one gene, one protein hypothesis. Through a variety of mechanisms, a single gene may give rise to many proteins. Gene precessions. From the genes closer to the original predicted number, one protein, one gene, one protein hypothesis. Through a variety of mechanisms, a single gene may give rise to many proteins. Gene expression can be regulated at several levels. Different genes may be transcribed. DNA transcribed from a gene may be selectively processed to generate which RNA research the cytoplasm to become messenger RNA, mRNAs. mRNAs may be selectively translated, and 4 proteins may be from the mRNA may be differently modified. Gene transcription. Genes are contained in a complex of DNA and proteins, mostly histones, called chromatin. And the basic unit of structure of chromatin is called nucleosome. Each nucleosome is composed of an octamer of histone proteins and approximately 140 base proteins of DNA. Nucleosomes themselves are joined into clusters by the binding of DNA existing between nucleosomes. Linker DNA with other histone proteins, HI histone and figure 1.1. Nucleosomes keep the DNA tightly coiled such that it cannot be transcribed. In this inactive site, chromatin appears as beads of nucleosomes on a string of DNA and it's referred to as heterochromatin. For transcription to occur, this DNA must be uncoiled from of beads. In this uncoiled active site, chromatin is referred to as euchromatin. Genes reside within the DNA strand and contain regions called exons, which can be translated into proteins, and introns, which are intransferred between the exons and are not transcribed into proteins. In addition to exons and introns, a typical gene includes the following: a promoter gene that binds RNA polymerase for the initiation of a transcription. A promoter region exon intron, exon 2 intron 2, exon 3 intron 3, exon 4. Datta box, transition intention codon, enhancer sequence, transition termination, poly A additional site, transcription termination site. Drawing a typical gene shows the promoter region connecting the Datta box exons that contain DNA sequence that are translated into proteins. Introns, the transcription initiation site, the transition initiation site that designates the code for the first amino acid and protein, and the 3 untranslated region that encodes the poly additional site that participates in stabilizing the mRNA. Allows it to exit exit the nucleus and permits its translation into a protein. Transcription initiation site. A translation initiation action site is designed the first amino acid in the protein. A translation termination codon and a 3 untranslated region that includes a sequence, the poly addition site that assists with stabilizing the mRNA, allows to exit the molecule and permit it to be transferred into protein.